It's okay?
Yep, tomorrow will be fine.
Okay.
All right, we should be live.
Good.
Okay, it's 9 o'clock. Good morning, everyone. Let's start with the Pledge of Allegiance. I pledge allegiance
To the flag
of the United States of
States of
America and to the
of
republic,
the republic for which it stands,
one nation under God, indivisible, with liberty and justice for all. Okay, again, good morning, everyone. First thing we have on the agenda is to approve the agenda. Is there any additions or corrections? Courtney?
I don't have any. If there's no additions or corrections, I'll make a motion to approve the agenda.
Okay, it's been moved. Is there a second?
I'll second that.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. Okay, next we have is approval of the minutes of last week on February 1st.
I thought the minutes read well. I make a motion that we approve them.
I'll second.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary? Motion carried. Okay, first thing we have on the agenda today is the Veterans Affairs fiscal year 22 budget. Antonia, go ahead.
Yep. Do you just want me to go down each one, or do you have any questions?
Yes. Why don't you go down each one or just basically where you got changes at, I guess.
Okay, basically the changes is the salary. We changed that to what I would make when I get accredited in June. So I'd be making $20 an hour. And so with that salary part-time is $31,184.87. That's with myself and the secretary. And then we add the 2%. So, and then for the FICA,
Okay, let's back up to, just for the rest of the boards. Scott was involved. No, Scott was not. Neil was.
Yeah.
Just to refresh the board, we started her at 1809 and then a 6-month review at 1875, and upon certification, $20. Now, we did make that certification if she didn't get it if she got it before the 1 year, then she would get the $20. Or otherwise, if she didn't get it 1 year, we'd go to 20. Because of the situation, that training is not available for that certification that readily at that time when we hired her. So that's why we put that in there. So I want to make sure everybody's aware that these were the steps agreed upon her employment. Okay, go ahead.
Then just the FICA, we increased that. Let's see here. And then the IPERS, we increased that to what it's supposed to be. And then the group insurance, we increased that. And then the rest all stayed the same except for the grade markers. We increased that, just a little bit to the $2,050 because we were short $36 the year prior. So.
Okay. So evidently, it's the first budget that we went through. You had made some adjustments on those wages after you reviewed it, and after I brought that up. Okay.
Right. Yep.
Okay. Anybody have any questions for her? I see you have a commissioner there. Do you have any comments?
No, everything's going real good, Gene.
I will say that I have had, since we've hired you, that I have heard a lot of good comments about your performance. So
I think
Yep.
Are your grave markers readily available when you order them, or are they getting a little bit hard to get?
claims.
Great, Mark.
Oh, grade markers? No, they're not hard to get.
Okay. There's a lot of metal products that are starting to struggle, and I'm just curious if you're on a big delay on those or not.
Nope, they're easily available. So far.
okay. Any other questions from any of the board members? Okay, again, as usual, this is your budget request, and none of this will be finalized until we do the final budget. So, and if we have any questions, we'll get back to you. Okay?
Sounds good.
Sound good, Gene.
All right. Thank you then.
Yep, thank you.
Okay, next we'll go through the HIPAA proposal.
Hey, Gene,
Yes.
we acknowledge that we got the letter from Ann Lander to resign.
Oh,
From the
yes,
com-
that's right.
Sorry, I just,
Are they still on there yet? I don't think so.
they're gone, but we should just
But
at
I
least,
think you, did everybody get a copy of that?
Yeah.
Yeah, I think we need to make a motion at this time to accept the resignation of Ann Lander.
So I'll make that motion with regrets and thank her for her service and her time that she's put in on it. She, every time I've been around her, she's fully committed to the Veterans Affairs and she's doing a good job. And with
Yes.
regret, her resignation.
I'll second that. And what I do think I should look, okay, is there any other, it's been moved and seconded. Is there any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. It was not on the agenda, but I do think that they have a person that's willing to serve on that board, and they will be getting that to us here shortly when I talk to her. So, and it will be another female, so to keep the board balanced. So we'll act on that at a later date. And that is only good till June, and then we'll have to reappoint that person. Okay, next HIPAA proposal.
Morning, everyone.
Good morning.
Good morning. Okay, go ahead.
I recently was appointed as our HIPAA officer for the Carroll County. So we're taking our first steps and getting a little bit of help from Gannon here. And he's going to explain what he does. So, Gannon?
Yeah, well, I have the ability, excuse me, I have the ability to share my screen, Dalton.
Go ahead.
Okay. It looks like my screen sharing is still disabled.
There you go. Advanced sharing options. I think, there you go. No.
Try again.
Perfect. Can everybody see my screen okay?
Yes.
Perfect. Well, I want to thank everybody for your time this morning. I have spoken with Dalton as he is taking on some responsibilities from a HIPAA perspective. We're an organization that works specifically with counties in regards to HIPAA with your chief privacy and chief security officers. A little bit about who we are. We were founded in 2012. We're strictly focused on HIPAA compliance for small to medium-sized entities, and particularly counties. We do have 5 professionals and 4 support staff here throughout the Midwest. Our current corporate office is in Crown Point, Indiana. I'm actually based out of Iowa City, so we're relatively close, and are spread out throughout the Midwest with our clientele that is nationwide. We've been in business for nearly 10 years. Our fearless leader there, Mr. Roger Schindel, who is also on the call today as well, and may chime in with some extra information if needed. Excuse me. Our entire company, especially our project personnel, are all certified with accredited and established certifications. So you're working with qualified individuals to help you guys focus on your HIPAA requirements. And what I would like to do a little bit is kind of build a picture of why HIPAA compliance is so important, and specifically from a county perspective. And we'll walk through some real life scenarios, just a few, and then I can walk through just our services in general on how we address those. And then I believe Dalton had issued each of you the proposal, or at least a very brief breakdown of our proposal for you guys to view. So we can hop right into those. So Dallas County, Iowa, they had a breach that included personal information of nearly 5,000 people that contained documents related to income maintenance and social work cases. So what happened is that a breach happened when a contracted custodial company mistakenly emptied boxes containing office information into the dumpster, and didn't realize it until it was emptied that it contained name, mailing addresses, date of birth, social security number, all protected health information from substance abuse and illegal drug use information. So really how this relates to HIPAA compliance is that there weren't policies and procedures in place. The custodial company wasn't aware of certain aspects and where things are housed specifically when it relates to PHI, and ended up doing things and emptied those out and ultimately released personal information. Now, up to this point, they've been contacted, sorry, last part of it, and have not received any reports of the affected parties and their information being misused. So close call. This had no repercussions from a fine perspective because the Department of Health and Human Services was involved. So the federal government didn't punish the federal government ultimately. Other county breaches. In Skagit County, Washington, someone inadvertently placed money receipts with electronic protected health information of 7 individuals on a publicly accessible server. This one where the Office for Civil Rights actually investigated and found out that there was over 1,500 individuals' information that was affected. The result of this is that they were fined $215,000. And really what happens after you're fined is that you become really put a bullseye on your back for annual reports due to the corrective measures that need to be taken. So moral of the story is having everything put together the right way the first time limits your exposure from the OCR. Jumping down to Los Angeles County, this was a fairly large breach, as you can see, 340,000 records. This comes back to some of the policies and procedures that are in place within a county. The Department of Health did not remove system access for 13 users after they were terminated. One of those users actively used the account and ordered laboratory tests for clients. So really there's the security side of things of where there's access limitations, hierarchies within your departments on making sure that when someone's terminated, all of their access is taken away and there's a process procedure in place for those things. They also failed to report 131 missing or stolen IT equipment items to the department. So that bounces back to having a good inventory and making sure that those are all all taken care of and accounted for, which is part of the HIPAA regulations. A couple more. Mecklenburg County in North Carolina. How this happened is that a Channel 9 was investigating county health departments on the failures to notify women of abnormal pap smears. Well, what happened is that due to the lack of training within the county, the Channel 9 requested information on that, and by accident or lack of training, protected health information was actually released to patients' information was actually released to the media outlet, which is a violation of HIPAA compliance. So it gave out much more information than just a few numbers that they requested. So that goes back to the training and policies and procedures. Kern County, California, the Department of Mental Health. What happened is the administrative department relocated in a single document. So there's the vast of 340,000 documents to this single document was left behind, but had over 1,200 lines of information, specifically due to protected health information on their internal record numbers, mental health services that were received and identified by their codes. So it comes back to that internal training, as well as ensuring that your vendor agreements are vetted to where these people doing these construction work are also in the understanding of what to do if they were to find some information. I believe this is our last one for breaches side. Here's really what's happening here currently, that dives into more of the IT and security side. What happened here in Los Angeles County Department of Public Health is that someone stole an unencrypted laptop from a third-party billing vendor. It involved holding quite a bit of over 160,000 records of protected health information, including social security numbers, billing information, dates, birth, and medical diagnoses. So a class action lawsuit has been filed, and I believe it's still ongoing, with a number of repercussions from the HIPAA violation side, as well as civil suits that were not timely notified and offered the free credit reporting or free credit monitoring that is made possible then. Jumping down to Orange County, California, the Transportation Authority, 88 servers were shut down for several days. This comes down to the IT side of things that Dalton's probably well aware of, as you guys have leveraged KnowBe4, which is a fantastic tool that helps prevent these sides of things. But what happened is a ransomware attack. Someone clicked on a bad actor's information and held PHI information from the Transportation Authority. Rather than paying the $8,500 ransom, the county opted to revamp their entire system. So they estimate that the attack cost about $660,000, including about over $300,000 in labor cost for the agency and contractors, as well as over $200,000 to emergency contracts with Microsoft and San Clemente-based Chief Information Security Officer. So this is really comes down to a reputational item going forward for the Transportation Authority now in the future. This one is unique in that HIPAA, instead of just focusing on, let's say, your public health department or ones that you can understand is like, oh, well, we know that they have PHI. That's something they focus on. This one is an interesting case in which a young girl was bitten by a neighbor's dog, and the girl's parents filed suit. The neighbor was actually a Rensselaer County jail officer that had access through the jail nurses hookup with a local hospital, and was able to look up the information of that girl while she was in the hospital. Excuse me. So had access to how she was being treated, what had actually happened. So when the girl's parents filed suit, the jail nurse looked up her medical records, The parents sued the county, the sheriff, as well as the jail officer who accessed all of the daughter's medical information. Since then, and this is how it creates a slippery slope, if one person has filed suit, an accountant who was employed for the jail for 20 years was let go. He claimed that his medical records were also accessed at the jail after he missed 2 days of work for being treated for high blood pressure. A former corrections officer and union leader also filed suit, alleging that this medical records were illegally accessed by the jail officials and allegedly under the orders from the sheriff. Another former correctional officer and 2 current correction officers also sued, claiming that their medical records were illegally accessed. And it really follows suit with another guard being also sued. So really is the focus needs to be on the training, accessibility, and that it involves much more than just your public health office. And what I thought was interesting and what's next on your guys' agenda was secondary roads. So I thought this was fitting to discuss. And you don't think that secondary roads people would be involved in the world of HIPAA, but they are. So this is an interesting case in that your secondary road employees would be involved in HIPAA and have access to that information. This is actually a request from the University of Iowa due to a child's chronic medical illness that a secondary road has to be cleared prior to other roads to make sure that they have access to get to the hospital at a certain time frame. So it just goes to show that that PHI and protected health information is kind of spread throughout the county and not just your standard expected departments. So for the common solution at counties, it's really to designate an overextended internal resource to develop and manage your privacy and security programs. But the problem and issues with that is that privacy and security programs are complex. It takes a ton of training to implement and manage all these privacy and security programs. And then to make sure that it passes regulatory scrutiny. Knowledge is expensive. Either you would not be able to pay them what they're worth in the market, or they would be underutilized. So really what we're offering is an external team that works directly with your chief privacy and chief security officer to ensure that those regulations are met. As you guys may have noticed, we proposed the HIPAA Select program, and how we're unique is that all of our service are required by the regulations. So we address all of those things for you. Our HIPAA Suite license is really our cloud and proprietary software that helps become a depository for your policies, procedures, helps with your privacy risk assessment and security risk assessment that is required on an annual basis, that we will also help your CPO and CSO walk through and accomplish, as well as building out remediation plans. So this can be done by roles, working with your department heads to ensure that all steps are being made and people have excuse me, have items that they're needing to take care of. We review all the policies and procedures with Dalton and your chief privacy officer, who would be responsible for those items, to make sure that those are realistic and are built out specifically for your county. We do review all your business associate management. So we're vetting all of your partners. And this is unique currently because of individuals having to be remote or having to utilize technology and partnerships that you may not have before COVID, to where we help you guys all vet each one of those to ensure that if they have access to PHI or specific information within the county, that we ensure that they're following the same rules that you are. Also includes annual support, where we'd be there throughout the year to help support each one of the individuals that are responsible, And we're open for questions from each one of your employees as well on, hey, I'm dealing with some specific information. How could we handle that? A big aspect is your workforce training. So I understand that you guys do leverage Know Before, but from a workforce training perspective, directly with HIPAA compliance, is that you have to be trained on the policy and procedures that you have in place within the county. So they're specific to those, which would address that in HIPAA compliance. Security incident assessment. This is if you have, say, a breach like those previous organizations, we would come in and assist and to make sure that all the documentation, all steps are taken appropriately to meet the Office for Civil Rights requirements. And if the OCR or Office for Civil Rights were to come on site, we're able to help organize that for an additional fee, but we don't charge it initially because if you're not using it, we're not going to charge you for it. Ongoing security and privacy program audit, that's done on an annual basis, which we would be a part of. An attestation, this is really one to show that that you have actively and made a good faith effort to become HIPAA compliant, as well as allowing that to essentially confirm to the community that you've taken HIPAA compliance seriously and that you're moving in the right direction. And obviously access to a consultant at all times to help support you guys. Are there any initial questions as far as the offering? Here are some of the clients that we do have, the number of Iowa counties, behavioral health regions, and others that we've helped support in the past. I think that is it from my presentation side. Did anybody have any questions, or Dalton, were there other items that you'd like me to address? I know that our proposal has a very detailed outline and of the deliverables of each one of those line items.
I guess at this point, I think you covered everything I wanted you to.
Okay.
So, I guess we're seeking approval to be able to do this at this point.
I have a couple of questions that I'll show this as a one-time fee, and that's a yearly fee, or is that a one-time and then a yearly fee afterwards?
Yep, it's an annual fee, and typically it's like going to the dentist. Essentially, the first year is the $14,650. And second year, after building the program out and having helped you guys through the tougher aspects of it, we typically offer a discount in years 2.
A year-by-year contract, or is this a 5-year commitment, or what is it?
This is an annual contract. Yep. Just a 1-year commitment on the HIPAA Select. If you were to do if you were to move up to, say, HIPAA Expert, to where we sign on as your Chief Privacy and Chief Security Officer, that would be a 2-year agreement. But anything other than the HIPAA Expert, it's an annual agreement.
What are those typical discounts for the second year?
10 to 15%, depending on the amount that we're able to accomplish. And I know there's constraints just from time and resources internally. So it's anywhere from 10 to 15% after that first year.
So let me ask another question. So if you are certified, do you require anybody working with you from the county level being certified also?
Certified in what aspect? From those accredited departments that I had mentioned on the first or second slide? We wouldn't require anybody internally to be certified. You'd be able to leverage our consulting team. We would have recommendations if we're wanting to take on more responsibilities, that I know that our consultants would say, hey, the best certification would be through the HCCA or CompTIA. I'm sure Dalton's familiar with that one. But there's a number of certifications that we would recommend if they're wanting to take on more responsibilities.
Okay, I've got a couple questions. One for Dalton. What do we currently have in place? Anything?
We do have some items in place. I wouldn't want to publicly speak about those, but we do have a lot of things in place. We have obviously a policy in place that does protect us, and we are following it. There's some softwares and stuff that identifies like PHI and other HIP information that runs on our network that does help us out a lot in securing that information and figuring out who has access to it. Like he had mentioned before, we do trainings, but we're hoping to expand the trainings by signing this company on. I have priced just going out and doing some of these items by myself, and it didn't make any sense to do it for the cost of the training and everything else that I'd have to do.
Okay. The question for Karush would be, what about the accountability? You know, maybe I missed that in here, but you know, how do we hold you accountable for your services?
Yep. So we have deliverables, and those timelines would be presented to you after the kickoff of the engagement, and you would be given quarterly updates on the accomplishments and the completion percentage on each of those.
Okay, so what would happen if after we had all this training and there was a breach? I mean, do you come in and assist in that then, or are we pretty much left out in the cold?
No, we absolutely work with you. Yep.
For the same amount of money, or do you start charging after, you know, with extra hours contributed towards the breach?
So if we have to come on site and work directly with the Office for Civil Rights, there is a $5,000 retainer. We do not initiate that right from the beginning because 9 times out of 10 it's not necessary, and we hate to charge you for something that we're not doing or performing. So that's always in the background. From a day-to-day incident perspective, say some information was left out or there was a request made that was, you know, out of the ordinary, our consulting team is with you throughout the entire time of it, as well as helping you document it and how to remediate those issues.
So this is Roger Schindel. If I can just jump in and expand on what Gannon said, and again, welcome. You know, thank you for giving us the time. The process, the way it works is you will have on an ongoing basis any number of security incidents and privacy incidents that you begin to recognize as you get training. The first thing we do is come in and assess those incidents for you to determine whether they're a reportable breach or not. That's part of the HIPAA Select service. If it is a reportable breach, we actually work with you to report the breach. Once the breach is reported, Office for Civil Rights makes a determination as to whether they're going to do an investigation. And there's 2 levels of investigation. The first is what's called a desk audit, where they ask you for a whole series of documents to review to determine whether they feel like you have appropriate safeguards and policies and procedures and training in place. And if they feel that way, they then send you a resolution letter that typically has a slap on the wrist that says no harm, no foul, we're going to move on. In our experience, we have had every breach with OCR end at that point, which is why we don't charge for the on-site audit, which is the second way that OCR will address a breach. If they're not satisfied by the document request, the desk audit, they'll then schedule an on-site investigation. That's where we would charge the additional $5,000 because, again, in our experience, we have yet to have a client have to go through the on-site investigation, though we've had dozens of breaches that we've had to report on our client's behalf to OCR. So our philosophy is don't charge for something that you're not going to need to take advantage of until that day comes. I'll also tell you that because of what we do with our clients, our goal, our achievement, and our accountability is knowing that you are going to have breaches that are going to be reported. Our goal is to make sure you come away with those investigations with no fines, no penalties, and no civil suits. And to date, since I've been doing this, we have yet to have a client who has ended up having a fine assessed against them or had a successful civil suit assessed against them. So from the accountability perspective, and Gannon showed you some of our county clients. We're happy to have you contact some. We'll give you references, but our whole goal is to make sure that you have no fines, penalties assessed against you or have to litigate civil suits. So that's the process of how we address breaches and where that additional charge would come in.
Thank you. That answered my question.
To follow up, how long have you been doing this service?
Sure, I've been doing this for 7 years, full time. And the company started as an online training company around electronic health record systems. And then we morphed into doing HIPAA training, and then realized that there was not a good source, credible source for organizations in the middle and lower end of the market to get quality HIPAA compliance consulting. And so we expand our services. 7 years is how long we've been doing this.
Thank you.
You mentioned a team several times. If we would have a issue, do you provide legal to also help with our legal side for direction? And
so we don't provide legal advice directly, but we certainly, if you needed it, could direct you towards a number of attorneys who we have confidence in that know what they're talking about when it comes to regulatory compliance, particularly around HIPAA. So the answer to that is we don't do that. We're not attorneys, but we would assist you in finding someone who would help you. But our experience has been that has not, as of yet, been necessary because we've been able to close the Office for Civil Rights cases just with the complying with their document requests.
thank you.
I guess my other question for Dalton would be, you brought this company to our attention, and I'm okay with it. I think it's really a small amount to pay for assisting us in being compliant with HIPAA. And I like the answer to the accountability question that I had. But my question is there others that do this, and should we be looking at others? I guess that's the only question that I have is, did we pull this company out of a hat, or have you been contacted, or is there others out there?
I had actually kind of sourced everybody. We have a county chat where we talk between IT directors, and this name came up to me 2 or 3 times through multiple sources. So I even reached out to some of the counties that are currently using them, and they had nothing but good things to say about this company. So that's why I felt comfortable go ahead and just one company and going through with them. There is a lot of stuff we have to show them on our network, like when we're talking about getting the proposal together and everything. So I just put the amount of work into this company.
Mind if I chime in on that a bit? In terms of our competition. So certainly there are other companies out there that purport to do what we do. Most of them, if they're doing the consulting, are not experts at it. It's an add-on to them. It's part of what they do. They don't have the certifications we've had. If you go out and look at the market, we're not the cheapest organization out there. We're not the most expensive. Our goal is to provide a service that you would get if you were Fortune or a Wilshire 5,000 company, sort of top tier company, working with a Price Waterhouse or an Acuity or Accenture, the top consulting firms in the space, but you could add a couple zeros to our price to do that. You will find we're not the most expensive, we're not the cheapest, we're in the middle of the pack by design, but as a value proposition, I would argue that you would not find an organization that has a track record like ours, that has the focus that we have, that has the customer satisfaction that we have. Every time we do a survey, we end up with 4.5 out of 5 stars in terms of people thinking that we make decisions in the best interest of our clients. I think that we're obviously strive to be I believe we achieve it, be the best value in the market for the dollars that we charge.
I only have one question, and this is for Dalton. So improve, have you done a risk analysis just within our own system of areas where they can be more beneficial? Or are we just looking to add on layers of protection we already do?
Well, the problem is there's so much I don't know.
Okay.
And even in talking to them, when I first got into talks with them, they probably brought up 10 things that I had no idea about. And something that we started doing right then and there because they just brought it up. So I guess I can't do what I don't know. So that's why I want to leverage this company to be able to help us out.
But can I kind of add to that if you don't mind? So the regulations require that you do what they call a security risk assessment and a privacy risk assessment. So within the regulations, there are 130 different vulnerabilities under HIPAA that need to be addressed. They're both on the security side, which are 80 of them, and the rest are on the privacy side. So one of the problems or challenges that organizations have, they hear a risk assessment, they think we need to assess the vulnerabilities of our IT systems to external attacks. And that is true, and that's part of what HIPAA is, but there's much more on the risk assessment side that needs to be evaluated to be compliant with the regulations so that when that inevitable breach is reported and investigated, you'll pass their regulatory scrutiny. So I just want to clear that there is a whole other side beyond doing things like vulnerability scans and checking open ports, out to the internet that need to be addressed under the risk assessment. HIPAA has a very specifically defined, specific definition for risk assessment. So just don't want to confuse the two. And I think that's what Dalton's saying, that part of it on the IT side he has a good handle on, and we can work with him on those. But then there's this whole other side that you need to be concerned about, that in most cases our organizations we work with had no idea we're out there before we started working with them.
Okay, is there any other questions? Dalton, you want us to act on this today, or you want us to consider it, or how the rest of the board feel?
Ask about budgetary. Where are you at in your budget? Is this something that would like to start immediate? Is it something you want to start with the next budget?
So Courtney might be able to answer that a little bit better than me.
Maybe. I don't think I printed it out. I put it in the budget for fiscal 22, starting July 1. I put it in kind of the same place that we pay for our audit out of.
Okay.
So it's Department 99, general fund. So it's in there right now. So the budget, the preliminary budget you guys got, it's in there. So if you guys choose to do it, I would recommend starting it July 1st for monetary reasons.
Right.
If you guys choose not to do it, I will need your money.
And just to make sure that everybody understands that Department 99 is a broad
Yeah,
It's not just IT, it's
Correct.
broad.
it's not, it's called the non-departmental department.
The HIPAA touches so many
And
pieces that.
Some other things that come out of there are our insurance, property casualty, that kind of thing, and audit, and some other miscellaneous. It is in the budget, because Dalton didn't tell me the cost.
You need to cut you off.
No, you're good.
Is there any comments from any of the board?
So I have a question. I've heard that school bus story before. So that person we had that gave us that presentation, was that just training versus an agreement? You guys know who I'm talking about? There used to be a guy that would come to the meetings once a year and give an overview.
I remember getting a HIPAA presentation
That's what.
before, and I can't remember.
Company.
Yeah.
Oh, okay. That's my
Yeah,
question.
so I think it was December 2019 was when they were here. It was shortly.
I remember something with this
Yeah.
company, but I thought attributed to a contact at an ISAC meeting.
Yeah.
So at that time, we were just paying them for that one-time training, where now we're gonna take them on. for
Yeah.
that. Okay.
Okay. Any other questions or comments?
I'm okay with this. I think it's a good move. It's an annual contract so if we do not, if something comes up and this is something that we don't want to continue, we can get out of it. So I would make a motion to employ Carroll Compliance Solutions to aid in our HIPAA compliance.
And that is starting with the new fiscal year?
Yeah, my question there is are you okay with that, Dalton, or Karush, can you give us a 6-month bid and half price and get us started immediately? I mean, that would be another question.
Well, so the way
can budget wise, can we do that, Courtney?
so just from Carroll's perspective, obviously we think sooner is better because we know that you're already having security incidents that are just not being recognized, and the idea is to make sure they don't happen. Typically what we do is we charge a client 60% at the signing of the contract and 40% when we deliver the remediation plan. That's part of the accountability. We'd be happy to split the fee into 2 pieces so that we could do part of it in this fiscal year to get started, and then put the other part into your fiscal year that starts July 1. That would allow you to spread the cost out, and we'd be happy to work with you on that. We've done that with some of our other county clients before, to address their budgetary considerations.
Courtney, were you going to comment on that?
Just that right now, we don't have any money set aside to pay for this. So
Okay.
if you guys do that, I would just need to know what amount we need to pay before June 30th. So the next time we do a budget amendment, we can get that in there so we can pay that. And if we set it up to where we start in March or whatever, and we know that we're gonna have to come up with that, and the money's in the budget for next year, so that wouldn't be an issue, but it'd just be an issue, we'd pull it from reserves this year.
Well, unless there are any concerns and somebody wants to amend my motion, I would just make it for fiscal 2022.
And I can talk to Cross after this, and we can maybe get something together to cover us the rest of the year if possible. So I'll figure that out.
Okay.
Okay, there's a motion on the floor. Is there a second?
I'll second that.
Okay, it's been moved and seconded. Any further discussion? All those in favor signify by saying aye.
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 Aye. Motion carried. Okay,
Thank you.
Thank you for your time, everybody. Appreciate it.
Yes, thank you.
thank you. Okay, next we have secondary roads.
All right. Stay quiet.
Here last week, I didn't know that.
Okay, you ready to go there? Zach?
Second. We're waiting on
Okay.
Rich. We're waiting for Rich.
Oh, okay.
Go ahead, yeah.
Morning, everyone.
Morning, Zach.
Want to start off, I guess, with the final payment change for the bridge replacement on 320th Street that we had talked about last week. There was another pay estimate that was paid, and that's what made up the difference of those dollars. So $9,578.81 is the amount that's due on the retainage for that project. So, and again, this was Gobbers and Smith who did the work on that project.
I will make a motion to approve the final payment and retainage for a bridge replacement on 320th Street.
Second.
Been moved and second. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary? Motion carried.
Thank you. Next thing on the list is right-of-way policy. This is something I think Dave had done previously. I think it's been a few years since he's done this, but basically talking about how we're going to accomplish right-of-way, if we need right-of-way for small, like structure projects, or if we're doing larger projects, how we would accomplish getting right-of-way, along with if we're doing any roadway borrows or crop damage for those. Most of this is very similar to what, very close to what Dave has done in the past. I did review some of the numbers to make sure we're still kind of in the right ballpark for All-Star. And again, we'll be going through, or we have gone through and evaluated kind of what the comparables are for comparable sales for future right-of-way purchases around structures and whatnot for small projects. So also fence removal and replacement as well for projects. So questions on this, I guess.
Those prices that you had in there, Zach, are those different?
They are the same, and I did some looking on Iowa State Extension, and they're still above what the crop production costs are. So I felt we were sitting in a pretty good spot with what those are. Yeah.
Okay, very good. What are you looking for here?
Just an approval of this. That way, it's kind of the policy going forward, continuing forward. That when we do buy, there is a couple small projects we may have to buy a little bit of right away, and I guess I thought it was good to revisit this before we go down that path.
So I would make a motion that we approve the right-of-way policy
I'll second.
presented today.
Okay, it's been moved and second to approve the right-of-way policy. Any further discussion? If not, all those in favor? Was there somebody that had a question?
No, I was thanking Zach for taking time to be proactive during this procedure because there are some stuff that's probably gonna come up this year, and instead of addressing it right when it happens, it's nice to have this in place.
Okay. All those in favor signify by saying aye.
Aye.
Contrary, motion carried. Okay, utility permits.
Two today, both from Mid-American Energy. These are basically fiber lines connecting to their substations basically and getting communication for their facilities. First one is basically from Highway 71 and 300th Street, out and around on Mahogany Avenue, back up to just to the southern edge of Carroll. Didn't attach the full plan set just because it'd be quite large, but they do have all the details on all their crossings of culverts and road crossings and all that detailed out. They'll be boring underneath all the intersections, as well as all of our culverts and structures. Otherwise, they'll be kind of following the standard when it comes to depth, as well as location for where they're going to be putting this.
Okay, you've heard the utility permit. Is there any questions? If not, we're in order for a motion to approve or deny. Also move to approve.
I'll second that.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. Okay, Zach.
Second one is also for Mid-American. This one is kind of going out and around Carroll, starting at basically where the city limits end, going north on Noble or Griffith Road, out and around north up to 30th Street, and then back around west to Highway 71. There's another stretch in there, obviously that's City of Carroll as well. But again, this is just getting connection back to where they're putting it in other right of ways, whether it's the city or as well as the DOT right of way. Same fiber, trying to connect their system, I believe. Same thing for location as well as depth and boring all the structures as what we discussed before.
Okay. Any questions? If not, is there a motion to approve?
I'll make a motion to approve this utility permit.
I'll second.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried. Okay, Zach, you got anything else?
One thing, I guess one quick question for you, Gene. Are you be able to stop in and sign these or sometime?
Yeah,
in the next...
Why don't you just leave them up there with Courtney? And I'll probably
do that
later.
Okay.
Okay. Next, we'll go to the payables.
I got one quick question for one quick item too that you don't have to act on, but I want to bring up.
Oh,
We,
sure, go ahead.
We had talked about here back, I think it was in December maybe or November. We are going to have our bid letting coming up for our asphalt project. And when we get to contract signing, either the supervisors, either the chairman, or now it could be myself as well, can sign that contract. Either way, one of us has to get set up for a digital signature through the DOT system to sign that contract. So I know we had briefly talked about that, but we'll have to kind of decide which path we're going to go down and then move forward on that coming up probably towards the end of this month. So I want to bring that up if we want to discuss it or move forward with it.
My thought is that we have you do a digital signature upon supervisor's approval. And as you get approved at a board meeting and you set up for digital signature, Because with that digital signature, what I found in the past, every time we change a chairman, then we have to change that signature. And that digital signature is a pain in someplace to get set up. So that's why I just soon have it done through you, and then it'd be done by board approval. Has anybody got any comments on that?
When we do that, if we would just make a copy of the approved minutes and place it with that signature, is that good enough?
The DOT requires that there is a resolution passed authorizing me to sign each contract that happens.
Okay.
And I can, there's a sample resolution that lays that out, and I can get that to you.
Okay.
It's pretty simple, I think, but they ask every contract has to be individually, I guess, authorized for me to make that, to place that signature. But that's probably still easier rather than trying to go through and redo the digital signature.
Right. This is a never-ending process.
It is.
And even if you're approved once, you have to be approved for that year. Is that correct?
Yep.
So,
Yep.
yeah, let's pursue that path.
Okay.
To make
Yeah,
it
why don't
easier.
you do that and get those that resolution lined up or whatever.
I'll work on that.
Okay,
Yeah.
anything else, Zach?
Go ahead, unless you have questions for me.
Does anybody have any questions for Zach?
Home removal going,
Not very good.
snow removal going fine.
It's going all right, but nothing works as well when it's cold.
No.
Thanks, Zach.
Okay, next we have is the payables.
I don't
Does anybody have any questions on the payables?
few actually. So in Department 61, the juvenile probation, is that just because the client is that expensive?
Probably the number of days.
Okay. And then right underneath that, the emergency preparedness, November 20th, what is that?
That is a grant.
Okay.
That usually we get money in and then it goes back out.
Okay.
So.
Yeah, that's a pass through.
Any other questions?
No.
If there are no other questions, I'll make a motion to approve the payables.
Okay, it's been moved. Is there a second?
I did.
Rich seconded.
Okay. I'm getting that time delay and I don't hear that. Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
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 Motion carried. Okay, next we have is the appropriations resolution. This is the resolution that we approved for the second half to pay the additional 15%. Am I right, Courtney?
No questions, I'll make a motion that we approve that resolution.
I have no issues with it. I'll go ahead and second that motion.
Okay, it's been moved and seconded. Any further discussion? If not, roll call. Yes.
I can't hear you.
Shetler?
Is that me?
Judy,
Yes.
is there a delay when we talk?
There definitely is.
Okay, you two, Dean, you're both getting it at the same time?
I guess I don't know if there's a delay, but I just couldn't hear it.
Okay.
Well, it's just like it's the first couple words that come out. I don't hear it, then all of a sudden it picks it up.
Ruggles?
Yes.
Houseman?
Yes.
Johnson?
Yes.
Hey, motion carries.
Okay. Now we have is the treasurer there.
I'll do that.
Say that again, Courtney.
I'll do hers. Why can't they hear me?
I can hear you. It's just first when you guys first start talking.
So I'll present the treasurer's semi-annual report.
Okay, now I heard that.
So the county treasurer prepares this semi-annually. We look for board approval before we publish it in the papers. So Lisa sent this over to me. I verified all her numbers with mine and everything looks really good. This is July 1 through December 20. So you can see the total reports there with the beginning balance, ending balance. This includes every single fund, schools and assessor, E911, all those that we normally don't pay a lot of attention to, except when we look at this report. So see that the ending balance at the end of December for all the funds is 18,801,882.59. So looking for approval of the report so we can get that published in the paper.
I will approve the treasurer's semi-annual report.
Okay, there's been a motion. Is there a second?
I'll second that.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye. Aye,
Aye.
motion carried.
Dalton, while Courtney was reading that and the camera was on her, she was breaking up. Did you notice that, Gene?
Yes, I did.
So I don't, if is it a tech problem or what? But that's the issue that we're having, is that it's breaking up and we can't hear her.
Maybe Courtney needs her own camera, just on her the whole meeting.
No, I think it's whenever, isn't he using that speaker that picks up as someone starts talking and moves to that person?
Yeah, but when you were saying that Courtney has trouble, and when Scott just talked to you, you didn't notice it, and they're sitting 5 feet, 6 feet from each other, so I don't know.
I think that's it. I think it's a directional thing, is when someone starts talking and then if it moves, there's a delay. And I think like when Courtney was talking, it picked up some other background noise and then it kind of breaks her up a little bit.
Do you notice any breakup when I try to lead you astray?
Well, that's always the case because you lead me astray.
Just see if you could hear me.
Yeah, but I'm not seeing you neither.
It's not switching over to you.
Yeah, I don't know what the issue is, but it's breaking up. And I think
We'll keep working on it.
Okay. All right, next is to review and discuss the resolution 2021-002, mandating the use of face coverings. This is, the reason this is on the agenda because ours will expire on the 15th and we do not have a meeting on the 15th. So that is why it is brought up. I understand what the governor's done, and yet I think we all have to admit that we're nowheres out of the woods on this thing, and that even with the new strains of COVID coming in, we need to address this situation. And I'll open it for any comments at this time.
Well, I can make a comment coming from Dr. Michelle Heim, who is the physician on the Board of Health. And I quote her here. She says, we do not have enough positive cases or vaccinated individuals to remove the mask mandate yet. we have about 10% of Carroll County with prior infection, questionable remaining immunity, and much less with both vaccines. We just started vaccinating our 65 and older population and do not have nearly enough vaccines to cover the group 1B that is considered non-healthcare essentials, i.e. teachers, police officers, and firefighters, and the 65 and older. I believe it will be mid-March before a good chunk of the group even gets their first shot. Carroll County is not getting allocated enough vaccines right now. Therefore, I think until we move out of that group, we need to continue to do the right thing. My fear is that after the mandate is lifted, people will stop wearing the masks. And again, businesses will again be stuck in the position of choosing for the safety of their workers and customers over the public pressure. In addition, that higher risk group should not be restricted back into their homes out of fear that others will not wear their masks to protect them. This mask mandate is not overly restrictive. People can continue to interact with the public and do all they desire, protects the mask wearer. It's my hope that we continue the mask mandate for at least 30 to 45 days until our vaccinated group can be expanded. Recent studies have suggested that asymptomatic individuals do in fact spread the disease very easily. And I find that most people are exposed to infected individuals during the few days prior to their symptoms developing. The mask, in addition, has been keeping our influenza cases down as well, giving our elderly population a fighting chance this winter. That was from Dr. Heim. This is a comment just addressing that from our public health nurse, Sarah Schulte. I agree with Dr. Heim. I also think it is safe to say that there are people that are getting sick with COVID symptoms and are choosing not to be tested to confirm that they have COVID or not. So then we have all these people who are out and about that are ill, and with the mask mandate, it helps decrease the possibility of spreading the illness. And I guess my only comment is that, you know, we've got this thing going in the right direction, and I don't think it's time to take our foot off the accelerator. You know, I would agree with Dr. Heim that, you know, the more that we can get further down the road with the vaccinations, the better off we're going to be.
Well, and I will say that I have had a lot of comments and emails and also text in regard to support of this. I agree with what Dean's saying, that we shouldn't let off the accelerator. To me, the idea we got things kind of under control. I think we all know that this is not going to go away in the near future, because with the other strains coming in, it's just hard to have a good control. And I think that the mask mandates have done what they're intended to do. We've reduced the things, the infections, to quit using mandating the mask. It's just like once you get the cattle in the corral and then you get them pinned up, and then all of a sudden later on you open the gate and see what happens. I'm afraid that what's going to happen once we open this up is our numbers are going to skyrocket again. We're going to have another surge. Yes, do I like wearing a mask? No, but I think it's what we need to do to protect ourselves and our other ones and our loved ones. It's only the right thing to do. So I'm still in favor of a mandate. I'll open it for any other comments.
Our cases are down from the contact tracing perspective. We had no new cases today. We had 5 Saturday. So our numbers are significantly down. And I do fully believe that's because of the mask mandate.
Any other comments?
I want to tell everybody that I think the citizens of this county have made a big difference by wearing their mask and washing their hands and doing their social distancing. And I think the message has been pretty loud and pretty clear. People are doing the best they can. They're picking their battles. And I think that's something that we should continue. My problem is I don't believe that county government nor city government should overrule the governor. Therefore, if you will change this language to strongly recommend that they wear their mask, I will continue to wear my mask, I'll continue to social distance, and I'll continue to wash hands. But the mandate side of it, I don't believe that we should override her, nor we would, and we have no teeth in our mandate anyway. We don't have a law enforcement person anywhere probably in this county that would enforce it. Private businesses, we're going to have to step up and make that choice. Do they want to continue? Do they not want to continue? I know the big box stores, from what I've heard, are going to continue to have mask mandates in their store, and that's their prerogative. But I'm going to lean the other way, and I would like to get rid of the mandate and just stay with a strongly recommend statement. I understand that a lot of people will discard that then, but I think with the governor already doing what she's done, a lot of people are disregarding it today, even though ours continues until the 15th. I think we're already going to see it. I've watched sporting events. I've been to a couple of sporting events. The numbers are coming up. People are starting to interact, and they've been doing it for a couple of weeks. I think that surge would start showing up now if we were going to get it. Like I said, I think people are doing such a good job of wearing their mask, even when they're in these crowded situations, that we should, that's the way, the path that I think we should be taking.
Comment from Sarah.
Yep, one comment from Sarah.
Is it the 4th or the 3rd?
Third,
Fourth.
sorry.
Oh,
Third.
currently the
Okay,
third best,
apparently.
okay.
Third best county in the state.
Okay. Any other comments?
You wanted to read that comment, Gene, or just let people look at it that are online, they can see it. Is that right, Ben?
I didn't see it.
I don't see it.
So it,
Chat.
So it says in the chat, Sarah Anderson, Carroll County is currently the 3rd best county in the state, a 3.9 positivity rate. Both schools in Carroll County, so they're going to keep the children wearing masks. I think you guys all bring valid points, and I can't say I disagree with a lot of them. But I do strongly from the beginning have stood with the mandate is unenforceable, and we're superseding our power as local government, trying to oversee the government taking place at the Capitol. So I agree with Rich in this. I'm for masks. If you're out in public, wear masks. I think people can step up and do the right thing. They have been doing the right thing without being technically mandated to do so, because there's nobody enforcing this. So again, I don't believe in the fluffy words or soft feel-good words. I get, you guys want to put some teeth into this, but the people are doing the right thing. As far as private entities, they can put up a sign. It's their business. No shoes, no shirt, no mask, no service. And that's where I stand. So I agree with Rich. If we change the verbiage to strongly encourage, and here at the courthouse, if we want to do the same thing, if you don't have a mask on, you don't get service. and department, or you go out to dinner, that if that diner says you have to have a mask on to reserve service, I think you have a respect thing. So I'm with Rich as well as changing the verbiage to strongly encourage.
I agree with Rich also, that I don't think county government should overstep what the state is, and then we should say strongly recommend and extend the date out another month.
Well,
Okay.
I'm concerned with the new variants that are going to become dominant variants shortly throughout Iowa. I think they're talking about that between the 1st and the 15th of March. These variants will experience increased transmissibility, so that, you know, it's going to be even more, the virus is going to become more efficient, and it's going to take more people. And I think that is a real concern of mine. And with that, I think I will make the motion then. I'm not think about make the motion. I will make the motion to continue the mask mandate as it has originally been determined for the next 30 days until the 15th of March.
I will second that. It's been moved and second to extend the mask mandate till 15th of March. If there's no further discussion, we'll take a roll call vote.
Sorry, Miners,
Yes.
Shetler,
Yes.
sorry, I'm making notes as I go here. Ruggles,
No.
Houseman,
No,
Johnson.
No,
Motion
Okay.
fails.
Motion failed. With that, I do not want to do nothing. So Rich and I have had this discussion, and that I have looked at this resolution, and I would make a motion then that we will amend the resolution to say, instead of resolution, it would be resolution strongly recommending. That's in the headline. You follow me, Courtney?
Yes,
And then if you go back on section 1, the word shall be removed and put in there, is strongly recommended to wear face coverings. Those would be the changes I would make. And I would like, being this is not as strong, I would like to have this go in effect after ours expires and go in effect till April 15th. That is my motion. Is there a second to that?
I'll second that.
Okay, it's been moved and seconded. Any further discussion?
we revisit it before 60 days, means we're doing a 60-day instead of a 30-day.
Yes, and it's the same basis what we did in the past. It will be revisited when it comes due, and we can also rescind this if we see things are a lot better than what they are, which I do not anticipate that things are going to be that much different. The biggest problem is we don't have the vaccines coming in, and it's going to take a while to get everything in place before everybody gets their second shot. And until that, until everybody gets their second shot, and we get probably at 60% of it vaccinated, I don't think we're still going to need to wear masks just to be safe.
So if the governor changes her mind to
Go ahead.
mandate, then we could also revisit this and change our verbiage also.
That's right. I would say that's right. And the reason, and Scott, the reason we went with a resolution on this originally is that it's basically we don't put ourselves in a corner legally, okay? So it's more flexible that we can do this with.
It's fluid.
Yeah. Because it is a fluid situation.
One other
Yeah,
thing I want
there's a possibility we may want to look at this if this passes in 30 days, if things are out of control and, you know, we want to look at this again and say that, you know, we need a more firmer resolution. So, I mean, that could possibly happen as well.
But, and I agree with you, Dean, because I think if this thing going on with lifting it now, I think we're going to see a spike in numbers myself. And I hope not, but that's my prediction. Any other comments? If not, roll call.
Miners,
Yeah.
Yes.
Shetler,
Yes,
Ruggles,
yes.
Houseman,
Yes.
Johnson.
Yes.
Motion carries. Gene, I'll get an
Go ahead, Courtney.
updated resolution, and you can stop and sign that when you sign the other things.
Okay. Now that we did this resolution, let's visit about what we plan on for the courthouse. My feeling is that the courthouse still should be wearing masks when they are out, when they are walking the hallways or with a customer, but when they're at their desk, that they can be without a mask like they've been in the past. And I think we still require people to come in the courthouse with a mask too. Does anybody have any thoughts on that?
I agree with you, Gene, and I think the verbiage on the sign out front should reflect that we strongly encourage you to wear a mask when you're in the presence of this building. I just think that's fair to our employees, and our employees are being fair back to the customers.
Well, my concern,
Traffic should be down some now, but we are coming up on tax day in March that could spur on some more traffic inside our building.
my concern is that we provide the best safe environment for our staff, because we don't not want this to get in a department where we wind up shutting down a department and can't have continuity of our services. That's my main concern. And the safety of the employees, of course, that's first, but is that agreeable with everybody, or does anybody else have any comments?
the sign says right now that our mask is required. Is that correct?
I think that's right, Dean. I think it does say required. Like I said, we can forget about that too.
I think it should stay required.
Yes, I do
think
too.
so too.
I agree.
Okay, we'll leave that way. So Courtney, if you could just let all the department heads know that. I mean, I have no problem if they're sitting at their desk without a mask, but when they're moving amongst the courthouse or with a customer, they need to be wearing a mask.
Nothing has changed.
That's right.
Office, they're still wearing theirs, right?
Yeah.
Yeah, but they're so close quarters, I think.
Yeah.
Yeah, I'm not sure what Lisa decided, but.
Yeah, they just can't get away from each other.
Yeah.
Okay. Next we have is the jail project change order number 6. This we had reviewed last, I think we got a week ago. Does anybody have any questions on it?
Yeah. Is this change order from Baiting or from Shive?
It's from Shive Hattery because it's got his signature on it now. What we had before was just it came from Baiting as for us to look at.
I still have an issue with the gas line. And my issue is I don't believe that the architect deserves any markup in that. First of all, it was forgotten off of the plans. Baiting construction, and I worked with Tony, and Shive had very little to do with this, and I don't think we should give him a markup, but I don't know if contractually we are obligated to that.
I think that's something we're gonna have to visit with Mike about personally.
So I think that's something I'm okay with approving this, but I'm also, the next meeting we have with them, I think that should be a topic of discussion, because if there's a refund, they can always give it back to us later. But I do think
and they may just not put that percentage on that. That's what I think, yeah.
cut on that piece right there. That's my only problem with this change order.
Yeah. Let's make note of that between Rich and I or whoever, that we have a discussion with Mike on this.
Make notes for our meeting on the 18th.
Okay. Any other questions?
Thanks, Gene. I just wanted to get that in.
Any other questions?
If there are no other questions, I'll make the motion that we approve this change order number 6.
Okay, I'll second that. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried. Okay, next we go back to budgets. Okay, Courtney.
Can you both hear me?
Yeah, I can right now.
Right now.
Interrupt me if you can't, and maybe if I switch seats, that would help. I don't know.
No, I think it's got to do with that system, because a little bit ago when Rich was talking, when he first started, I couldn't hear him.
All right, so I'll go ahead and get started. The first one I have here is DHS, which is Department 38. Mary Jo gave me this via email, and I noticed that it was down from last year. So I told her that I'd go ahead and present this to you all. And if you have questions, you're more than welcome to get a hold of Mary Jo. The main reason they have decrease in costs is because many of their employees are working from home due to COVID. So you'll see their office supplies went down, postage, let's see, and office equipment went down. So fiscal 21's asking was $71,700. Fiscal 22 is $68,000. So a little bit of a cost savings there. In the revenue side of it, you'll see the 7760 that hasn't changed. That's the money we get from counties to offset our costs. And then the 45 estimated we'll receive from the state for their. That may be a little less since their expenses are a little less, but that is the DHS budget. Is there any questions on that one?
You must be anticipating that in next year's budget, they're not going to be out much. More than that lately.
That's my understanding, yes. Yeah. Okay, so I'll move on. Next one here is for the auditor, which is Department 2. Revenues, really no change. I did reduce miscellaneous fees to be more representative of what we get on average. So you'll see the salary line is less. What I did for fiscal '22 is I have a deputy that I'm gonna have paid out of the supplemental fund. We'll get to that in a minute because that line's higher than last year. So in the salary line, you'll have my salary, also the administrative assistant, and there's some money in there. I hope to hire somebody. We'll have a retirement in November. So I'm planning on hiring somebody in July so they can work and get trained by the individual prior to her leaving. I'm hoping to find somebody with some HR experience. I realize that that may come at a cost, but that's going to be part of the interview process, and see who we get for applicants and see what kind of salaries we're looking at. It may be that I'll need to come to the board, have a really good candidate, and they have strong HR skills and certification, education. We may need to look at paying that person more if that's the route we want to go. I think it's a good idea to get somebody with some HR experience. That's what the salaries entail. Is there any questions on that? Is there any concerns about hiring somebody in July and having them work for a few months getting trained before the other person retires?
Actually, I think Courtney has come up with a good plan. When we did the budget, I liked what she had proposed. She may run into, her only snag is I think she may run into some issues with the hiring of that person with some HR experience. That's going to come a little bit more of a shinier coin than what we had, but I think that's a good move because I think overall that could be a benefit to the county in a large way of having HR experience.
I agree with you, Rich. We sat together on that meeting. I think that's probably good to hire someone in advance that, because in that position, again, there's a lot of that stuff doesn't happen every day. So it gives them that experience for over a longer period of time to understand a lot of those things that happen not as frequent. I think it's a good plan.
Okay, so you'll notice that the FICA and IFRS obviously will be adjusted accordingly because of the salary reduction. Insurance, it's kind of a guess. We don't know what kind of insurance, or if any, the new hire would take. So that's kind of a guesstimate there. Otherwise, go down here. I did reduce mileage and subsistence mainly because most meetings are being held virtually. Reduce education and training, just aren't going into as many training sessions. Reduce the office data processing and maintenance quite significantly. Used to be that Pitney Bowes, we just paid all of that, and now that's coming out of each department. So I reduced that to kind of factor in what we've been spending the last several years. We've not spent $6,400 at all, so I did $2,500. That. Dues and memberships, I left the same. Office equipment and furniture, I guess this would be another ask. So we have a copier in my office that is, I believe, around 7 or 8 years old, and it's time to get replaced. So I did budget some money in there to replace our copier. I kind of looked, there's been some other departments that have purchased them recently, so I kind of used what they had spent on there, hoping to get a color copier. So some of your scans and copies when you need them, when I email them out, will be easier to read. But looking forward to that.
And doing that without a service contract, right?
Correct.
Purchasing and owning.
Yeah, we'll purchase that copier outright, and then we'll have a maintenance agreement on just the copier itself.
Leasing,
Yeah.
not.
No.
I feel, and this is just my opinion, on a county level where we have money available to buy it, we're not on a constraint of not being able to afford it. It makes sense to buy.
Leases get pretty expensive, Scott.
Okay, yeah, I was
We had a
curious.
couple other departments that we truly did an analysis of, is it better to own the lease? And
Perfect.
in the long run, it is cheaper to own than lease the whole time.
So we're probably looking at around $4,000, $5,000 for a copier. Obviously, my budget's not asking that much, but I don't foresee any equipment needing to be bought. Use that. Okay, so that takes care of the general basic. You can see the asking in there went from 269.7 to 237. Most of that's reflected in the salary I moved around. Is there any questions on the general fund? Okay, I'll move on to the supplemental. Fiscal 22 will have city school elections, so you'll see some revenue for that, getting paid back for those. I budget every year for at least one special. That's where the 5,500 comes back in revenues. Moving down to expenses, you'll see a significant increase in the salaries. That's due to moving my deputy auditor from, it was getting split between general and supplemental, and I've actually moved 100% to supplemental. There's less levy restrictions in the supplemental fund, and since I'm going to be hiring another person, the 3 people out of the general fund, I didn't want to overwhelm. So that's why I moved that. It's been done both ways. You can see back in 19 and 20, it was all coming out of there. But I think for now, until we kind of see where we end up with employees, this is a smart make. You'll see that the FICA, IPERS, insurance, they all reflect that salary getting moved over here. Otherwise, let me move down. I didn't do much. I did reduce in mileage and education and training. Increased publications and notices a little bit. It seems to go up every year. So printing and programming went up $3,000. That's an estimate on what I think it's going to cost to print ballots and program our equipment. It just costs more every time we have an election. And election officials, I did reduce that a little bit, mainly because it's a city school election, so I won't have to have as many workers. But that's the supplemental fund. You can see the asking is quite a bit more. That's mainly due to moving that salary. The other expenses didn't really change too much. Auditor budget, do you have any questions on that one?
I do not.
No. Nope.
I'll move to the supervisors. That's department number 1. Not a lot of changes in this one. And obviously, that's some numbers after I get done, but that's totally fine. Salaries obviously stayed the same due to the motion you guys made on salaries. So you'll see the FICA, IPER salaries didn't change. Insurance is actually going down. The new supervisor is on a different plan, so therefore there's reduced costs there. A little bit of savings there. Office supplies, you guys are doing good on things that you need. If you don't have it in the cupboard, we usually have it in my office and we don't buy it just because it's easier just to let you guys use some things. So I did reduce that to $75. I thought that would cover any incidentals that might come up. Board proceedings, I left that the same. Mileage,
What is all that cover?
which
Board.
anything we publish in the paper.
Okay.
Minutes.
So it's technically publishing.
Yes, yes. Mileage and subsistence, I lowered due to the fact that you guys just aren't really driving and going to meetings, spending the night, hotels, food. So I estimated $8,000. Obviously, that's quite a reduction, so we can talk about that if you think it needs to change. Telephone left the same, reduced education by just $100. And that's mainly just because I looked at the previous years. Legal and court, we usually leave that the same year to year in case we have any fees that come up unexpectedly. I think the union costs come out of there, if I remember correctly, the money we pay Von Bokren and Associates, that kind of thing. So that's kind of just been a standard number that we've kind of kept. And I did increase that a little bit, just based on the high year in 20. I know we spent a little bit more in 21, and I did look that up, and it was kind of a one-time thing that came out of there, but that's where I ended up with the board. So do you want to talk about the main change, I guess, would be the mileage and subsistence line that I reduced significantly? You think it should be higher? You think it's okay?
I think our largest training and probably expense would be ISAC's spring conference, which is now being held virtually. So I think it's okay that this year we did go lower, because we're not going to be having the travel or the hotel. We're going to be doing it virtually.
Yeah, and that will be on this current fiscal year though.
Yeah, we're talking about 22,
Yeah,
the spring of 23, correct?
yeah.
Or spring of 22.
If you look back at like 20, because that'd be a good estimate, we were at 8,600 for the year. So 8,000, I mean, that's pretty darn close. But then if you look at 19, it was 12. So.
I think we leave it where it's at for now. We can always, if we have to, if things change, we can always do a budget amendment on if we have to.
And usually there is some money to, there's some money in that legal and court related services we budget for just in case. So there is a little extra usually to pull from other lines overall, but.
The new regions that I've been involved with, we've set it up that the region pays the mileage, and so that's not going to be an expense. I don't foresee. I think you're in good shape, real good shape.
So otherwise, I think the supervisor budget is a reduction as well. We were at 349,000 back in 21, and we're at 344, almost 342.5. So some savings there for sure. Okay. Next one is Department 51. That is the courthouse and the back and maintenance. So this one was interesting because we have utilities that we pay, and we're going to have a brand new jail we're going to be paying utilities on. And I don't know about you, but it's kind of a guess. The building is a little bigger than the courthouse, but it should be more efficient. And also we'll have some utilities to pay for the tower sites and stuff like that for the radio system.
Correct.
So this was just a guess. I think 22 is going to be a year that we figure out what our utilities are going to be on that new jail. Get a year under our belt, and I think for budgeting wise, it'll be a lot easier to do next time. This year was just kind of a guess.
Yeah, and the expenses of the generators, city
Yeah.
sites, we've got a whole bunch of things.
Yeah. I don't know.
Yeah, exactly.
Okay, so I'll go ahead and,
Courtney, on those tower sites, shouldn't that go back to E91?
I thought it was the county was gonna pay for.
Or go to communications, I guess. I guess it really doesn't make a difference. Never
I
mind.
don't, I was gonna say, you've already approved the comm center budget, so I couldn't really add anything to that.
Yeah, leave it. Okay, never mind.
So miscellaneous, that's just odds and ends, once in a while we sell a desk or sell a chair, miscellaneous. Salaries would be just the 2.5%. Part-time left that the same. Increased overtime because, as you can see, we've spent a lot in overtime.
What would be a suggestion?
Well, when Zach came on after Glenn retired and he moved into his position, we tried to hire another full-time person, and it was a challenge financially. To come on for what we were willing to pay, and we pay a part-time person that is here minimally. In my opinion, it should be a 2 full-time person position. I just don't know that financially if it's gonna be work for us to get a full-time person with what we are willing to pay. Because, I mean, we're asking somebody to take on a space that's where he's at now.
Were contract services looked at that time?
I'm not sure.
A lot of times they're not cheaper.
Yeah, I don't know.
It's just curiosity.
I don't hear any complaining from our maintenance. He does a great job, but sometimes I think that he could use some extra help. And, you know, maybe it would be something to look at contract work for sure. But I do have some money, it's $24,000 in here in salaries. I don't know.
What was, if you can remember, a while ago, when Glenn retired, what was the starting wage you were considering to have a second?
Upper 30s. Upper 30s.
It was around 15. Someplace in that.
So, yeah, that may be something we need to keep talking about. But for now, that's what it is right now without making any major changes. IFRS, all the suggested increases there. Supplies, I left that the same. Increased telephone, because I'm sure there'll be added costs with more lines and things over there. Gas increase, it was kind of just a guesstimate. Electric and water, all the same things. I did increase building maintenance, $10,000. That may be a little high. Obviously, for a brand new building, you'd think you wouldn't have much in the way of repairs. But then part of me thought, well, let's increase it. And then if we're over in electric, then we can pull from there too. I'm not really sure on that. The fixed plant equipment, I lowered that significantly. If you look at that for 55,000, that's a little deceiving. Normally it's 12 to 10. That $5,000 roofing project that you guys approved in the budget amendment for the Fricky building, that's in there. Okay. So it looks crazy. So normally it's 10, and I moved it up to 25.9. So there's some increase there. Extermination, I know for a fact it's going to cost more for him to come and spray. He's told me that. So I think because he's going to have to spray at each individual for him. Trash, I increased that. Ag and horticulture, I left that the same. And then security, or I call it, that's actually the safety committee, that $4,000, I left that the same. So there's a lot of what ifs in this budget, and I really think it'll be a good year before we have an idea of what our utilities are going to be over there. But I'm totally open if you feel that any of these need to be changed. Like I said, I just try to use the best guess.
So what kind of expenses does the safety committee have? Just curious.
Trying to think of some of them.
But don't they pay for the hearing test and some safety equipment?
Sure.
Would that also include some in and out money that we get from?
That usually goes to
insurance?
other places.
Okay.
Yeah. Yeah, a hearing test, that's a big one. We pay for that out of the safety committee. I think once in a while they'll pay for different safety vests, glasses, that kind of thing, but the main thing would be the hearing test.
Okay.
And it's important for us to have a safety committee because for our work comp, they like to see that, and our work comp rates are going down.
Is there insurance?
Yeah. Yep. So that's basically, that's probably the biggest.
I think that fall underneath your realm, you do on the
Safety
committee.
It was under Neil.
It was under Neil, so I assume that you.
Okay.
So
It's probably been a while since they've had a meeting.
probably the sheriff usually lines up those meetings, and
Right.
Zach's a part of that too, so if you ever get a chance, you can jump the sheriff, Zach. Custodian. Maintenance, yeah. That is the Department 51 as of now, unless we make any changes.
And there was a few dollars that we maybe earmarked for a remodel
I'm just getting to that.
and or, okay.
Talk about Department 99 again, because that's where all the money go, or that's where you spend money when it's kind of a different situation. So in Department 99, I did put $15,000 in it as an expense. That'll come out of the general fund and move into the capital projects fund. That would be a capital projects that's for court or county use, I guess. It's not really earmarked per department. I believe there's about $30,000 in there now. It's been in there for quite some time. So when I had my meeting with Rich and Jean, we talked about that and said, how about 15? Obviously, $40,000 or $50,000 isn't much to do a remodeling project, but it is a start. And that money can only be used for a capital project once you move it there. So we can do that. We cannot do that. It's entirely up to you.
For making the boardroom better.
That's for all areas that we would choose, either remodel this area or remodel it. It gives us the flexibility to do those capital projects that we think that that's probably the direction the county should head. There's two schools of thought on this. You can put a money at a time. You can wait to the other end and bite the big bullet when it comes and it hits your budget all at once.
That looks like it'll be well, there's already 30 in it.
Yeah, well, we're getting there, but it don't take long to gobble up. Not on a remodel anymore. But that's what it's for.
So that's what's in here. Like I said, it would be, there's no money expended to come out, as far as a project, because we obviously made any decisions on what you're going to do, but it would be sitting in reserves in the capital fund for future. And it doesn't have to be remodeling. It can be any capital county project, not even specific to the courthouse. It could be a different building, or whatever. But, does anybody have any issue with setting that money aside, or do you want to talk about that?
I think that's a good idea to let it set aside, because it gives us a place to pick up and take care of some of the things that come up unexpectedly. And we know we're all talking about doing some different things downstairs there. And I think leave that capital in there for right now.
Yeah, I think it's difficult to determine what amount to put in there, because we haven't really had a substantive discussion about it. You always have to remember that when we are setting these budgets, this goes until a year from now, So I don't know what we're going to be looking at in the spring of 22. So
I'm glad you brought that up, because I think, we had a department head meeting last week and talked briefly about who'd be willing to move where and what we're going to do with the space. And I think it'd be really good sometime if the board could maybe set up a meeting and meet with the department heads here in the courthouse. And you guys can hear what everybody's thinking, what everybody's opinions are on, are they willing to move offices? Are they, because we have some people that have some requests in. I know that we're going to have to find space for Fisha upstairs. It's my understanding that she's going to lose her space when we do what we need to do up there. Something about her space is going to become a judge's office or something, or so. And that was news to me.
That's new.
And that position used to get stuck in the basement, and She goes, I don't care, I just don't want to be in the basement, which I don't blame her. Yes, juvenile. So I think it'd be important for us to maybe set up a time to meet with, you know, the departments in this building, because they're really the ones that are going to be affected by what we do, and get some ideas on what other people have. Obviously, we're not looking at spending any money right this minute, but I think it'd be good to get everybody's opinion and find out who's willing to move, who's willing to share, and who's willing to just stay where they're at.
Right. I think that's a good idea.
So, you know, obviously, I don't know when a good time would be. We'd probably do it via Zoom or something, but maybe once we get this budget done and get those meetings out of the way, we can start looking.
Let me run this past you, Courtney. We're talking about having another budget, just a workshop, right?
Well, depending on how today went, yeah.
If we invite all those people in, we're gonna have issues with social distancing. And would it work that we move out to the Swan Lake Center and have it out there and do our budget thing after we meet with those people? So we have an idea if there's somebody that's got something short term that we can kind of maybe change things in our budget yet at this point, and we'd be able to social distance. And we would be able to do it face to face once.
I guess there'd be two things I'd say. Number one, we'd have to check with conservation and make sure it was available. And number two, we'd have to check with IT and see if that's a possibility to do that. Because obviously you'd want to offer the meeting like you have been to the public.
Well, if we're all going to be there.
Well, yeah, I mean.
Well, that or just leave it open to the public to attend.
Yeah, the public can
Correct.
attend that meeting if they choose to do so, I guess.
I guess, yeah, I mean, are you gonna offer it via Zoom? If not, and it's just a public meeting like any other public meeting, public's willing, open to attend, then obviously you probably wouldn't have to talk to IT. But if you want to have it like this, we need to make sure that that would work.
And we can check with IT if it's not a big issue.
Is it a big?
I
You don't
wasn't in
know
our
yet?
meeting space, so I couldn't.
Okay. All right, we'll look into that and find out for sure.
I think
But I
so.
think even if it's any amount of work for them, I think we just publish a public notice and have the public invited to it.
Okay. All right, do we want to talk right now about when we want to do that? Does anybody have any conflicts this week? Obviously, we probably couldn't do it till Thursday.
I won't be.
Unbelievable.
Are ya?
This week's bad. This week's bad. No.
And we're off President's Day.
Yeah.
So we have a meeting Tuesday.
Yeah,
after
we're
that.
meeting on
Oh,
Tuesday.
okay.
Thursday I could do, but I've got a 2.5-hour meeting right in the middle of the day, so
Yeah.
Friday I'm not in town all day, so.
Well, or maybe we could make, if this week's busy for people, maybe we could make the 16th be strictly, because obviously it's not a bill day, and depending on what other departments might have for the agenda, we could make that budget and that too on Tuesday, the 16th.
That-
If
I'm
this
all in
week's,
on that.
if this week's crazy.
The
for
only
people.
outside thing we have is the conference board that's wanting to maybe meet.
Yeah, we don't know when that's going to be.
Well, let's set our meeting now and then we'll know.
And then we'll be ahead of them.
Our meeting's at 9.
Is there a problem with this week? Did I understand or what?
We have several people here that are not even available on Thursday or Friday, and those are the 2 days. we
If you
have.
don't go tomorrow, I'm butchered up all week.
And we have to meet requirements as far as,
Right.
What about an evening meeting?
well,
No,
Okay,
it's a lot to ask department heads to come back at night, but I mean, we could, I guess. But if you guys are open to it and we're still doing okay time-wise on our budget, if we could settle things on the 16th and then also meet with them.
Sounds great to me.
okay. What time are you thinking?
Well, your normal meeting's at 9.
You want to do it at 9?
Well, I don't know. It's hard to judge how long it's gonna take.
Well, I'm gonna throw another thing in there too. I think while we're doing this, if we are meeting face to face, that at least all 5 of us, we probably should have a photograph taken so we can update our website too.
Yeah.
Oh, yeah.
With a
Yeah,
buffalo
I
in the
forgot
background,
about
that's
that.
one light.
Well, what a perfect place to take a picture out of Swan Lake. So, do you want to just plan on 9 o'clock on the 16th and move the meeting to the Conservation Center? And
Why
have
don't
the
we
regular?
do that unless there's an issue out at Conservation Center? You check that out. And let Cindy know that we're gonna meet at 9 o'clock. So if she's gonna have a meeting, she has to do it noon or after, I would suggest.
Well, that's when your normal board meeting is because of the holiday anyway, so.
She could move that meeting out there too, and then we could all just stay and accomplish that, and it'd be a little more space.
Oh, I see. That would be our regular meeting then, wouldn't it?
Yeah.
Yeah.
Okay,
So unless another department has something that's pressing that needs to be on the agenda for the 16th, which I can only think of one that might have something, but we'll just plan on it being a regular board meeting. We'll discuss with department heads possible scenarios for doing stuff here. Let everybody get their opinions out there so you guys know what people think, and then we'll go through the budget
okay.
as well. Okay. Where did I leave off? Oh, general assistance. This one looks really good. Obviously this year, we're not gonna spend, we budgeted, but that was back when we had a part-time director, so. This year that we're in now. So really the only cost we'll have, obviously the contract with New Opportunities. I put $14,600. That's what we've agreed on with them. I suppose that could change a little bit if they decide they need a little more money, but that's what we've agreed to so far. And then medical, same. The expenses for the assistants has stayed the same. So the overall cost is $39,600, which is significant what we have been spending, which is a good thing. And I think we're providing a good benefit to the public as well. Is there any questions on this one, or do you feel we need to increase any of the assistance lines, or do you feel that we are where we need to be?
I think we're fine on that.
I like it.
Now, before I forget here, is IT listening to us right now?
Ben's in the room.
Ben's here.
Okay, Ben, I'm gonna tell you, every time it's gotta be something with that audio. Even when before I noticed Dean dropped something, then Courtney cut out. And I just did a test a little bit ago. I coughed while you were talking and you cut out that short period. So it's when that thing is directionally picking up that voice, it's cutting out the speaker. Even there's a noise in the background. Okay?
You guys at home remote need to be more quiet then.
Well, I am trying to be quiet, but I know it's not only us, but it's when any other noise it picks up.
There's going to be a change once we're done with the meeting, sound suppression. I just didn't want to mess with it when we're in the meeting, so there's an extra couple settings we're going to change again.
I think they got some ideas, Gene. We'll just have to keep playing with it. And I
Okay.
think wherever we wind up with meetings, that environment will change again, and we'll have to make adjustments at that time.
Yeah.
So.
Okay, well, that's all the departments I get to present. I don't think I left anybody out. So after that, I had on the agenda, the budget work session. You all should have received a budget. And I didn't even bring mine down here. So I'll have to go get mine. It's on my desk now with the county budget. I thought I brought that folder down, but I didn't. So I guess, talk about that, but you should have got a preliminary copy of the budget. I hope. Nobody's.
Yes.
Yeah,
Okay.
we got it.
Okay, good. So I'm gonna have to go up and grab that folder for myself, but, other things I had on here are the departments that ask for additional monies. How do you want to handle that as far as the budget goes? And the nonprofits, you all should have received the spreadsheet on that as well.
Yeah.
Okay, I'm gonna go up and grab the budget.
So give me a favor and
Yeah.
actually.
Yeah, would you all like to?
Yeah.
Please. I think you have one. Yeah. Okay, I'll be right back.
We'll take a little recess here while she does that.
I'll just keep working.
Stephanie, Stephanie,
Yes.
do you tell any difference on us when we're talking?
No, you guys don't have a delay. It's just here for some reason.
Yeah, I think it's that equipment that we're using. It's going directional and it picks it up. And if someone starts talking and another one talks, it's really bad.
I just don't know if it's our connection or what it is, but I know Ben's gonna try some stuff. Well, actually, right now would be a good time if it's just clip clips.
on it.
All right, I turned on some noise suppression. Let's, can you tell me if that helps at all?
Okay, I'm not. Go ahead and do it. Start talking.
Hear me, guy?
No, keep talking. See if I can cut you out.
Gene, how's the weather down in Templeton and how much snow did you get last night?
That's better. When I cough, it ain't cutting you out. I think that's better. Did you?
Morning's a real getting.
Dean, did you tell anything different?
Well, no, but I don't know if it was comparing apples to apples. I guess we'll have to see how it goes, through the rest of the meeting. But I think you're right. I think you're right, Gene, that's what's happening.
Well, I noticed it even like when Rich was trying to talk over Courtney, started asking and they were both talking. It really was bad. Is everybody back?
Yeah, if you want to. and if, conservation isn't available, I would assume they are. I don't think people are booking big meetings right now, but, we could always ask upstairs and see if the big courtroom's open too.
Yeah, that's a possibility. Well, and it wouldn't be bad to have one off-site too, neither.
Totally okay with that.
Yeah, if it's not available, see if the courtroom is available. I guess I'd prefer to do it out there where we can kind of hammer things out.
On the 16th.
Yes. Probably
I'll
say
say
9
all
to
day.
noon.
Okay.
Unless the conference board wants to meet, so I guess you could say possibly all day.
Yeah, I'll just put it down. She usually responds right away.
Well, Courtney, if she's gonna do hers by Zoom, she probably don't want to go out there because she'll want to do it here, so.
I'll just do hers, yep. We need 3, right?
Yeah. I forgot something.
We gotta get copies yet now?
Yeah, it's fine. Just want to make sure you guys all got the email I sent with the resignation. For the
I did.
Courtney, you gotta repeat that all.
wanted to make sure you got the email I sent regarding the Maple River Township trustee that resigned. I know Dean
Yes.
got it. Okay. So you guys will need to do some work and see if we can find somebody to replace him.
Yeah, I'll report on that
Okay.
in committee reports.
So while she's doing the copies of the budget, in that budget there, I did not put any of the nonprofits in there. So none of that's in the budget that you guys received. It was easier for me just to leave it out since you haven't made decisions yet, than put it in there, and worry about taking it back out or changing it. So those are not in there. Also, the budgets that the departments presented to you is what's in the budget. So if there's some changes made, if you guys decide to not allow or something, we'll have to make some adjustments. So just wanted to let you know that. And it's you two, I'm because everybody else left.
So Courtney, which if the nonprofits were in the budget, what line would they be on?
Several places. So if you look at that spreadsheet that I give you,
Yep.
you can see like the majority of them are general basic. And depending on what service area they're in, a lot of them are 3s. So you'd see it on service area 3 page, which would be the same page as like Carrie, environmental health, and the board of health. There's a few in the department.
Thank you.
And then if you go down below, you can see the ones that are in the rural fund, which is your libraries and soil and water. But a majority is the general fund.
I thought you had them in there already, at least with these preliminary figures. Okay. That's why it looked.
Easier for me.
That's why I thought it looked awful good.
Well, I think it looks pretty good, even if we get the nonprofits in there. I was kind of surprised. So, because I would like to point out that the overall asking in the general fund, so our max levy, $378,219, which is what you see on the fourth page of the budget where it talks about where the levy rates are. The total expenses actually are after revenues, it's more like 5.9 million. So there's a shortfall of approximately $582,000. Well, I didn't want to go over the levy of 3.5 because that's the max, unless you do some other special postings and things like that. So I did reduce the levy to get it down to the 3.5. But over $500,000 is getting pulled from reserves. But you'll see even doing that, the estimated ending fund balance in the general fund at the end of this budget that we're talking about now is still $1.5 million.
Where was we at that a year ago?
I'm sorry, what?
Where were we at that rate a year ago?
Let's see here. I got it written down here somewhere. Sorry, I gotta find it. I thought I'd written that down. It was 1.53.
Okay.
What I was doing is trying to make. Now, I want to clarify that there's some money in there that is definitely kind of money that you wanted to set aside. So the estimated ending fund balance is $1.5 million. Now, out of that, $766,000 of that is farm proceeds. Okay, so for the sale of the farm is sitting there in reserves. And also that $250,000 we got in COVID money is sitting in there too. So now we're looking at almost $1 million. 1.5 may seem like a lot, but $1 million of it is money that is not really, it's reserve money. So really the balance is like $500,000. Does that make sense?
Okay.
So it's a little misleading because there's money sitting in the general fund that we have said we're going to use for other things. And that is not part of this budget. I did not move any money around to offset any levies or anything like that because I wanted you guys to see where you'd be at. And I'm estimating that the lost local option budget or local option balance at the end of fiscal 22 is going to be about $1.3 million. That's if we don't do anything out of there. So we have about 1.3 to work with to utilize if you want to use that to offset some levies or whatever. So that's
And
the
you said
main
that's the end of 21?
22.
All right.
So that's kind of just a rough overdraft of that. I wanted to let you know that there was a little bit of a shortfall and you're pulling from reserve. You're
Which is where we were.
yeah. I don't recommend going over that because the max is 3.5. You can for specific reasons, but just because you've got more expenses isn't really a good reason. So if you have the money to pull from reserves, I think that's okay. However, the 1.5 they say you're going to end up with, 900 of that is really money that's kind of there for other uses. I think the county farm, we talked about trying to offset debt, the debt levy with that. So.
Well, isn't that COVID money to be replaced back in the local option it's money that we spend it out of there?
No, this particular money was used for salaries. This is the money we got back from the state.
Okay,
So the it went to offset salaries, so that actually went back into the general fund and in the rural fund to offset those salary expenses. We didn't have really any additional salary expenses due to COVID, but the state allowed us to apply for money to offset those costs. And so that's where the money went back into. When we get money from FEMA, hopefully soon, that will go into local option.
okay. All right, that's one that goes back in local, and we have not received that yet.
It's still in, I get a call from her every week to update me, and it's still in process. So we've done everything we need to do. We're waiting on them.
Now, my next question to you, did we get some money this last week for CARES money that the treasurer would have got? That was additional money that we got that we didn't have to apply for?
Not that I'm aware of. I know, not that I'm aware of.
You might want to check, and they're suggesting that we make sure we use that back for public health. And I don't know how much that was. So we need to follow up on that.
Well, and if it came for public health, I might not have seen it because it might have just went in and we figured out it was for public health and it would have went in the way of a pass through, would have went in and
Well,
out.
my understanding, there was no strings tied to it. And it came to the treasurer. So just, we need to follow up on that. Okay, let's go back on the budget. Let's get this.
So a question that I have, you mentioned FEMA dollars.
Yes.
What kind of money are we talking there?
I don't have that in front of me.
Okay,
It's been,
all right.
it's been months since I've submitted that and I don't even remember where it ended up. A lot of numbers looked at since then, but compared with the amount, and if I had to guess, it's a couple $100,000.
I was thinking it was in that 225 range, but I can't remember the number.
And we'll have to resubmit again for our contact tracing, because we'd already submitted our request, and then we started doing that, and that's been significant expense for the county. So we'll want to apply for that, well, and I don't know, usually they send out a notice when we can start applying for that, but with the numbers slowing down, it might not be a bad idea to submit that for the expenses we've already had.
Try to get caught up.
Yep. Since it takes.
Okay. All right, let's go on the budget, Courtney.
Okay, so, with this, I'm gonna call it preliminary budget I ran, you'll see that the levy did increase both on the urban side and the rural side with the numbers that I have in there. Urban was 0.38 and rural was 0.29. Obviously that would change with any changes you guys make to these numbers, but I thought it'd be good to at least have an idea of where we were sitting at before you guys talked about the departments that had asked for some additional money for some things they wanted to do, and also for the nonprofits. So I guess I'd at least like for you to all look at the nonprofits and maybe make some decisions on those today if we have time, and also on the departments that maybe ask for some more money. If we don't continue this next week, but.
On the nonprofits, Family Resource never approached us this year.
They received grant money and they did not request any funding.
Okay,
I'm not saying they won't next year, but this year they weren't going to because they've received grants.
all right, where do we want to go down the line? Is there any place you want to start at?
No, the nonprofits?
Yeah. Just want to go down the line?
I could start at the top and work your way down, I guess. Was that in the nonprofit? No, that's.
Okay, so the only ones that we have changed has been Region 12 had some changes. new opportunities, I don't think had any changes. Does anybody have any problem with, from foster grandparents on up? They did request more money, foster grandparents, didn't they?
No,
No,
the only one in that group on up is CADC. They're requesting more money, but
Well, according to the sheet I got here that, or I'm on the wrong line. Excuse me, I was on Elder Bridge. Okay, so we get down to CADC. We'll start there. Any comments?
We're at 70,
They're
75.
75.5 and they requested 80,000. That's kind of misdeceiving because they go by an annual calendar and we're going by a fiscal calendar. So that's, I think there's, but anyway, it is an increase. And I don't remember what percent that was. I do know they've been very busy with trying to help people with this COVID as far as the CARES money and all the other funding streams that have been available. I actually think they did a very good job for what all the stuff that's been going through their office. I know they've been very busy. So I'll open it. You guys know how I feel about CADC. They're our right arm of economic development, and I think they do a good job.
Well, and I guess I would agree with that, Gene. There's a lot of counties spend a lot more money on economic development, and just for an example, I asked Richard Crouch down in Mills County. Now they're also on, Glenwood's right off of 29 and 34. They're right on 34 there. They put $500,000 every year into economic development, and it's a different deal down there. But still, my argument always is that this is where the increase in our lost dollars come from, is through hopefully the efforts of CADC. So I think you kind of said the right arm of economic development, Gene. I would have to agree with that a little bit. I think if you cut that, you're kind of cutting a couple of your fingers off, because lost money does, a good economic development group will generate lost dollars for you. And I think they've done that.
Well, and the other thing is they also generate the increase, they help generate the increase in tax valuation. And that's, we always look at our valuation sheet when it goes up. Some of that is due to their efforts.
The only concern that I have with a lot of these nonprofits is because of the unusual situation this year in the COVID, the CARES Act. How many dollars are they getting besides, and Family Crisis Center is one of them, I suppose. I'm sure that they've got CARES grants, and the county fair got $50,000 from the CARES dollars. I don't, to be quite honest with you, I'm not sure if that's a good thing or a bad thing, but is that something that we need to be looking at as far as going ahead? So.
Well, and I think on the fairs, they did reduce their asking from last year due to that, I think.
Yeah, I would agree.
I think they kept it level, didn't they?
yeah.
According to sheet.
I have the level.
In 2021, the 21 request was 20,000.
Yeah, 21. They requested
20,000, and then we gave them 15. So they're staying to what we gave them last year.
Going back up to CADC, let's get that one hammered out first. I think I have reservations sometimes. But I hear your points. I hear both Dean and Gene, I hear both your points. They are a valuable asset to us. I would have liked to stay at level spending on them this year, but, as I would a lot of other ones, I'd like to stay at level spending or decrease. There was some grant money out for some of these organizations. These have been started. There are some counties that don't give anything to anybody. Now, whether that's right or wrong, I'm just saying that's the other side of the coin. So,
Well, and I think one thing about on this list, Rich, there's two of them that I know that are probably required by law, by code, that the supervisor is supposed to support, and that is economic development, which is CADC, and then probably the other one is libraries to some extent. They don't put a dollar amount on the libraries, but those are two that I know that are required by code that we fund somewhat. And CADC, I get CADC is any economic development. I guess it's not CADC in particular, but CADC last year requested 77,250, and we gave them 75,500. This year they're requesting 80,000, which is only above their request last year's like $2,500 or $2,700.
So the last 2 years, the 2020 budgeted and the 21 budgeted, we gave them the same amount, correct? At 75,500?
No, 20, they requested 75 and we give them 75,500.
Well, that's what I'm saying. What we budgeted though, what we budgeted for the last 2 fiscal years has been the same.
Yeah. So their expenses have gone up. I don't think that, I think they're entitled to it myself. How's the rest of them feel?
I guess I'm torn. I agree with you guys. I think they do deserve it. I think there can be better communication, and I think in anywhere there's rooms for improvement. But I would like to see the city, the county, and CADC kind of start coming together and work and be more progressive. But that too, Shannon does a great job, and I think that's maybe a conversation somebody has with them. But from the state of the counties I've gone to throughout the state of Iowa, Leadership Iowa, this might have been a program she may want to look at too, because it really will open up your eyes on how different counties function, how they collaborate together, and they have great initiatives to do great things. I'm not saying that we pay what they're requesting or we give what they're requesting. I do think we need to give them some money, but then, like Rich said, there are counties that don't give out any money because there's a fine line of what entity or nonprofit you give money to, because why wouldn't every nonprofit come to the county? And I have a hard time giving taxpayer money and deciding where that goes when they could go to the taxpayer themselves and the taxpayer could give a donation to that entity. So there is a fine line, and I can see why there's some sour feelings on doing this, but these are great programs, and I would hate for our county not to offer them.
Well, as you're aware, Stephanie, CADC does go out and do a private donate or fundraiser too. They get from private businesses and stuff.
I'm telling you right now, I actually have I don't know if you guys are aware, but I am the president of the Community Foundation Board, and tonight's our meeting. And there is a lot of these entities that are on here that are 503Cs that come and ask for grant funding as well. So they do go out and look for other grants. So I do get that.
Okay, anybody else on CADC?
Well, I say we fully fund, unless somebody else has another option that they want to bring forward.
Yeah, I'd go along with fully funding them this year. Their request. Anybody else?
I think we should fully fund them this year. I'll go with that.
Okay. All right. That's agreeable. Then we'll go down to the next one is foster grandparents, the same. Elder Bridge is up a little bit. That's based on per capita. That is one that when I started, they said, don't ever not fund them because you get more back there than what you pay for. So I would say we leave that alone. Family Crisis Center has requested 10,000. I think they've done that the last couple of years and we've given them 6,000. I think there again, that's a good program, but
You know, there again, so you have the Family Resource Center did not contribute or did not ask this year because they got grant funding. And so has the Family Resource Center or Family Crisis Center also got extra COVID funding? And do they actually really need even the 6,000? So, I mean, that's where I think it's kind of it's a tough thing for me, the same way with, when we go down here and we talk about community of concern, I think we need to give what they ask, community of concern, but they have gotten considerable amount of dollars donated this year. But there's probably a very good need for that. So I just think that some of these are really, really very difficult to determine unless you just fund them, period.
well, and there's some of these you kind of wonder, I think they start out good, but you kind of question why they've gotten to be an annual thing. And I understand some of them, that's how they get their match for their federal grants. So what's everybody's concern about, thoughts on Family Crisis Center? Dean's expressed his. I guess I would say let's leave them at last year at 6,000. Is anybody else in that same thought?
I would agree.
Level funding for them is plenty.
You want to repeat that, Rich?
I think level funding is okay for me. Some of my concerns, and don't get me wrong, there are people in need. I understand that, but a lot of these programs are going in with no parameters. And I have some deep concerns about the hands that are in this pot taking from them. Now, there are people that desperately need it. There are some in there that probably aren't as desperate as they would lay it out to be. But I don't know if that's up to us to try to square it up or them to try to square it up.
I think that's
the problem. And I feel like I'm trying to square it up when it's really their job. So when they come to us and ask, and when I ask that question, are there any parameters for this funding or for these services you're providing? And they say no, my ears sometimes go quiet because I don't want to hear anymore.
And I agree with you, Rich. There's people that are in need and there's people that aren't in need that are taking advantage of these programs. And that's what you're concerned with. And I am concerned too. I am concerned that there's also some of these programs where we're having some double dipping, but that is a concern I think we have to let to them to administer, not us.
It's hard though.
I know. It's all right. So we want to leave Family Crisis at where they're at then. What about the county fair then? They asked for 15,000, which is less than last year.
Well,
I don't know how much affair we're gonna have again this year. We may be in the same boat that we were last year.
what I'd really like to see is if we give them the $15,000, I'd like to see their loan balance reduced by $15,000. I guess that's kind of what I would like to see. I mean,
I'd rather not have any more improvements. I'd rather pay off what we've gotten improved so far. They've done some good improvements, but I'm getting a little concerned about that debt hanging on the other end.
Well, and I'll tell you, I get people that are concerned about, they say that this money's going to the 4-H clubs and the kids and stuff. And there's people out here are very concerned about that statement anymore. I've had a lot of comments on that. But I think, we're not going to predict what the fair is going to be like this year. I guess I'm in favor of giving a 15, but I think too, we ought to let them know, let's get the debt down.
I would agree.
Is that agreeable to everybody?
Yeah.
Okay. Next we have the Historical Society. I'm not even gonna touch that one. She automatically did that her own, with what their usage is, she reduced it. I think we fund that one. Community of concern. Anybody, any issues there? Or leave it?
I have a general question. Out of all of these spaces, how many of these are repetitive services?
I think there probably could be a lot of them, Stephanie, to answer your question. But they also, there may be repetitive service, but some offer more services than other ones. So I don't think all services are repetitive from one organization to the next. So some are more. It's kind of hard to judge that.
I had that question when I got on the board too, Stephanie, about duplication of services. And I think there is some of that. I mean, I think there's some things that New Opportunities does that probably a little bit the Family Crisis Center does. So I think there is some duplication of services a little bit. And is that kind of what you're asking?
A little bit, yeah.
But I think people feel comfortable going to one place as opposed to another. And unless you're going to start eliminating some of these, I don't know that the request will go away. That's kind of how I looked at it over the years.
Stephanie, I'll give you a little, my thought on this, and we'll use New Opportunities. New Opportunities and community of concern. Definitely they overextend each other. The thing is, New Opportunities also goes into a lot of other avenues. Now, if you take New Opportunities and Family Crisis Center, New Opportunities administers a lot of different crises throughout the whole family or through the whole system, whether it be financially or mental or whatever. But family crisis, they tend to deal more with abandonment and abuse type situations than what New Opportunities does. Not saying that they don't, but they're probably more geared up for it. Okay.
Thanks for the clarification.
Yeah, so some of it's based on each situation is a little different, I think. And I agree. I think, there's some duplication, right? But I don't know that you're ever going to get away with this because each organization tries to have more fingers to meet their budget. Otherwise, they can't justify themselves to pay their help. Does that help you? Okay. So community concern, leave alone.
I'm okay with that.
How about you guys at the courthouse? Okay.
Yeah.
Okay, what about the daycares? I think we leave them at level funding from last year, what we give them last year.
I would agree.
The only change would be in the Manning daycare event, because everybody else asked for level funding.
Yeah, I'm saying they all should get level funding. Is that agreeable to you, Carroll?
Yeah.
Okay. Manning Main Street. They've been requesting for years. We didn't give them anything last year, and this year they requested again.
I think we passed this year.
What's anybody else think? I'll tell you what I think. I think they've gotten quite a few years in here. I'm not saying that they should never apply again, but I think I agree with Dean. Let's pass. We're going to have other communities who are going to want money. And I think, we can't be just feeding it all one direction.
Well, there again, that comes out of, to me, it leans back towards the CADC. So if we're gonna have a pool of money and we're gonna give it away to each community, it's gotta give someplace else. So,
Well,
and that's
I
kind of
tell you,
my,
yeah, I think CADC is thinking that maybe there should be a pool of money locally to do for development. The problem is this Manning Main Street is more dealt with Manning Main Street far as upkeep and things like that. So, but is everybody agreement to pass now?
yes.
I would, Rich, you make a good comment there, and I think that I think at some point in time there should probably be a discussion about that. Maybe, there are other communities, if they had dollars, they would probably do some things. But
I think we have to look at it as a pool, and
yep, I would
we gotta
agree.
do it. So,
Okay, we'll leave that one the same then,
Yep.
or we'll just skip them this year. When we get down to the budget though, this year, Courtney, either you or I need to write them a letter and tell them that they were not approved this year. Because I think they kind of got a shock last year when they found out they didn't. Okay. Soil and water. What's everybody's thoughts on there? I think Dean fell off.
Fell off his chair.
Yeah. Soil and water, what do you want to do on that? Leave it?
I think so. I don't know what else to do with them. I think they do provide a pretty good service.
I would leave.
I will say this, through my conversations, I find that there's a lot of counties do not fund that, but well, I'm fine with leaving it, so we'll leave it then.
That's that question too. I got the same answer.
Are we on year 3 for the library? Carroll Library?
Okay, libraries. They're requesting the same as last year.
Now, are these all by code?
It is by code that we have to fund them, but it doesn't specify any dollar amount.
Okay.
Am I right, Courtney?
That I could find.
Yeah.
I believe that's right, Gene.
This is what they figure we're paying for the rural portion of the county. You want to leave them there, same as last year?
One second. Have you ever been in a library presentation?
Yes.
Well, they typically tell you how many people came through. But I don't know if they're counting you as 10 times you've been through the door or you're one. That seems to be the argument, because we really, if we have a rural customer coming in and using their library services, we probably should compensate them for that. But sometimes the numbers they bring, I don't know what they're.
Well, this one over here hasn't even been open yet, right? Or is it
Not
slightly
over here.
open?
Slightly. It's my understanding that they, in the letter, that they said they were asking for level funding due to the fact that they haven't been open 100% of the time through the year.
They are open. I went in last week and checked.
So I guess, should it be level or should it be?
Well, there again, that's probably another CARES funding that may have been received and we don't know. There's no way to know.
Like, no, like, where does all this funding go to? Is it for salaries? Is it for expenditures? Is it for operating? Is it to improve? Is it books?
I think general budget.
I think it's all above.
Okay.
I'm okay with leaving them the way they are. I've got not so much me as much as the other inhabitant in this house uses that library. I can't tell you how much. I mean, I think she's got probably 6 books on ebooks waiting to read books. And I think it's out to probably March or April before she can get any of those books. So, the rural areas are using that library. I don't think there's any time that this person goes into Carroll for whatever reason, does not stop at the library. So it's not me, but it is, there are people that really use the library. So the way it looks, we budgeted the same amount that they're asking this year, the last 2 budget years. So they have not increased, or we've not increased over the last 2 budget cycles. So I'm okay. They didn't raise it. I mean, I can remember back, Gene, and you remember this too, that, we scrutinized this considerably and we gave them only a percentage of what they asked for. And so I'm okay, since they have not increased it, to give them the level funding that they're asking.
Yeah. I mean, and usually go ahead.
This is also another one of those things for you two to keep in your back pocket for the E911 issue.
Yeah. Okay.
Another little piece of pie that they don't recognize that they're getting. Because the city people pay for these taxes for these things too. So just another.
Well, Rich, I think you're wrong on that. This one does come out of rural services.
But that library is supported by the city also.
Yes.
And if our funding went away, those libraries most likely would still be there. So me as a city person paying taxes on my city and now paying taxes on my county library, I feel like I'm being double taxed. The same argument that they give us for the E911. So it's still money out of my pocket. And I understand what you're saying, but because this gets spread differently than it would if it was in the general. Is that correct?
Well, the money that for this here comes out of levy out of the rural. Strictly the rural.
The rural residents.
Paid for that.
Correct.
All right.
Okay. Does that take care of things on that, Courtney?
Oh, I think we're in good shape.
What else do you want to cover today? you want to, what about mental health? Where do we wind up on that?
Total funding is 786,435.
Do you want to repeat that?
Total funding is $786,435.
Okay. How much of that did we offset last year with local option?
Last year, it was a $725,000 expense, and we offset 100% of that.
100% of it we offset on local option?
Yeah, that's what I recall.
Okay. What, do you want to cover those things today or think about that or?
I think first you need to decide on what you're gonna do with those departments that ask for more money before we decide.
Okay, so which departments do we want to have come back in or yet you want to talk about?
GIS, recorder, conservation, and attorney.
Well, really aren't a lot of those, I mean, if it's salaries, there's really not a lot we can do.
Well, but there's extra money in there though. Do you want to repeat them again? It was GIS, attorney,
Recorder and conservation.
okay, yeah.
There's three of them, right? GIS, recorder, and conservation.
And attorney.
And attorney?
Yes.
Do you know how much extra he had in there, his budget?
We might have. Gene, do you think it'd be beneficial that if we schedule a session and each one of those department heads came back so that we have questions, we get interaction there and get it solved?
Well, what I was thinking about, if we don't have that, anything but the budget Monday and with the department heads, that after we get done with our meeting, that we call these and then do our budget workshop after that. And I think have these people available that we can listen to, unless somebody else has a different idea.
I think I would like for the department heads to be there, that way you hear it exactly as they are seeing it, rather than.
We heard them once.
Yeah.
Did
I
they-
think conservation, didn't he give a pretty?
Yeah, he does.
He gave a pretty detailed, and it's a philosophy thing to me for him.
Plus, you'll be there anyway, so.
Correct.
Well, so do we want to just wait till Monday then, or Tuesday to go over these?
What'd you ask, Gene?
Do you want to wait till Tuesday and do these also?
Fine with that, but after that, we need to kind of
Crack the whip.
be done.
Well, my question, Courtney, you'll have a laptop there that you could plug in different figures and we can play with the numbers?
If they have Wi-Fi there, that should be, yes.
So we're basically down to these four and how much we're going to shift around from local option and how much we're going to use from the proceeds from the sale of the farm.
I wanted to let you know that we're estimating right now that loss will be at 1.3 million at the end of 22, not using any of those. So that's what you have to work with. 120,000 in the general fund reserve account that's leftover proceeds from the county farm.
Did you say that was already intended to be spent somewhere else?
Well, at the time, I think we were going to use that to offset the debt for the ISIX program.
Right.
Well, obviously that ISIX thing has changed. At that time, we were gonna be doing a lease every year, and now we have some cost savings, so, in the budget, there's a long-term debt schedule towards the back, and you can see that the ISIX payment is gonna be $5,746 for the year. So if you did wanna do that, that's the amount that you would need to offset. So,
And I'm not in favor of doing that. I think because that ISIX and the jail now are on debt service. So we are getting taxes off of the TIF areas, which we normally would not get. I would sooner put it back on a general fund and reduce the overall general taxes.
should have been more specific. I meant take that forward and reduce the reserves and offset the general basic levy.
Okay,
Obviously, like you said, you'd leave debt alone because we're getting a benefit by levying out of that fund, so.
Correct.
Yeah.
Right on.
So I guess, that's the thing we need to decide on those departments that are asking for more, figure out what you're gonna use to offset any of those levies on the general fund side. And you'll wanna do it on the general or the supplemental, because those hit both the urban and the rural people. So that way everybody get a benefit. You obviously don't wanna do it just on the rural side.
you're right. That's why I said general. So,
General, and usually what we've done is the supplemental.
well, if we move enough over, we basically don't need the supplemental, right?
Yeah, last year we didn't levy for supplemental.
Okay,
So those are
So-
the main things.
let's all review this stuff over to next week, and then next Tuesday, let's pound her out to the last end here. Is that agreeable with everybody?
Should not be a problem.
Is that agreeable with you, Rich, and Stephanie, and Scott?
Yeah, we're all good with that. I just feel like I need department heads here today. So when you ask the question, you all hear the answer, not secondhand.
Okay. All right. Let's move off budget and let's go to committee reports.
Okay, I'll go first. On the 4th, I had a conversation with our state senator on 2 bills. One was the Senate File 77, which deals with the compensation board. Had a discussion about that. The other one was the bottle bill discussion. He's switching some of his support over to that piece of legislation. We had a long chat about that one. I don't know where that's going to go, but I think I know where he's gonna wind up standing on this. He would like to get it, either we give him more money or we get clear out of the business, one way or another. And I think I have a tendency to agree with him on that side of it. Then I listened in on the legislative forum on the 6th. Also on the 6th, I had a call about a vaccine issue. And I know we've all been contacted about people, and I appreciate their emails that they're concerned about getting in line for the vaccine, and I'm glad we have that kind of participation. I'm glad we have that kind of interest in it. This one was a little different. This is a person that has started and has been trapped in the middle of a suspension. So, but I think I've got Sarah Anderson has been great all weekend. I followed her on Saturday and I got to compliment her. She hung right in there with me and did a good job. And I think she's got a handle on how to handle it. So she's going to let me know this week how it went. So this coming week, the 10th, I'm scheduled for Denison for the Western Iowa Workforce Development. That meeting is in Denison on the 10th. The 11th, I have a COG meeting, Region 12 meeting. And on the 12th, we do have to be in Sioux City by 8:50 in the morning. We're doing the Rolling Hills tour of all the properties that Rolling Hills owns. There's a lot of new board members and we can all physically see it, so we know what we're talking about when we do those buildings come up in the conversation. And other than that, I have had a lot of emails and I will be responding to the people I have not. I'm gonna try to do a general response. And I do appreciate all their interest in everything that they've contacted me about. Other than that, that's it.
Any idea what the comp board is gonna go to?
The comp board, no. I think the Senate feels one way and the House feels a different way, so I have a feeling it's not gonna go in.
Okay.
So that's kind of the general.
I can go next.
Okay,
Last, I listened in on the secondary road ISAC meeting, and Zach evidently has done a good job. And then tomorrow I have the landfill meeting, executive board meeting tomorrow at 6:30 a.m.
that it, Scott?
That's all.
Okay, who wants to go next?
I can go next. I really didn't have any formal meetings last week. I had a lot of correspondence over the vaccine issue and the vaccine rollout. And I think everybody kind of knows how that's going and how everybody feels that they need to be the next one to get the shot. But as long as we abide by the priority list, I think that, and everyone observes that, I think we're all better off for that. And I think, Gene, you've mentioned it before, and we just need to be patient. Our turn will come and we'll get vaccinated. So there was a tremendous amount of discussion over that last week. Also, Maple River Township trustee, Richard Baumover, has submitted his retirement letter. Courtney, if you would just send that out to everyone, I think that's one to cherish, to be quite honest with you. Richard's 90 years old, and he says, well, you know what? It's just time to maybe not do that anymore. So I've talked to one of the other township trustees who is also getting up there in age, and the third one here is going to be 85. So it looks like we're probably going to be having a new slate of Maple River Township trustees probably within the next year. And so I've contacted quite a few. I think we got somebody for Richard's replacement, but we're still looking for replacements for the other two. So we'll keep working at that. Stephanie, I don't know if you saw that there's a Carroll County Coalition meeting on Friday. We haven't had one of those for a long time. So we will get an update from the Public Health Department, Carroll County Public Health, and we'll probably be reporting on that on Monday. So that's what I've got this week, and that's it. I'm sure that there'll be more that I don't know about.
Okay, I'll go next. Last week, on Tuesday, I had an executive board meeting at the Yes Center. Basically, we had a board meeting to approve a resolution of banking by the executive board for the sole director. And this was a resolution that we approved so our director could go to the bank and sign off on borrowing some money because we are buying some cars to replace. We did lose one in a snowstorm, and they did find one that is a pretty good buy. And just in order to make sure cash flow goes good, we were going to borrow part of that portion of that and just to keep the cash flow. So that was that meeting on Tuesday. And then also, oh, I lost my goddamn place here.
Can you blame Ben and the IT department for that?
No, I can't. I'm gonna blame Gene Miners for this one. Okay, there I get her back. Then also on Tuesday, I had CADC board meeting. We had a meeting there, and then the CEO of Golden Shovel was on there, Aaron Borchal, and he gave his talk, and that was consumed the whole hour. Friday, I did set in and do the webinar on the statewide supervisors meeting, and went through that. One thing I would say, this last week, I had a ton of emails in regard to the COVID and everything, whether it's masks or vaccines. This week, or last week, I also did the radio and paper. This week, on Tuesday, tomorrow, I will be tied up for the bigger portion of the day to do the final judging on the ISAC scholarships. And I think that's pretty well what I got, unless something else comes up. Also, you might have got that letter from Courtney from the city of Carroll, is in regard to an annexation that's on. They're having a consultation meeting on February 24th at 11 o'clock. I don't think there's any need to go to that, but it's just a voluntary annexation on everybody's part except for one. So that is my week, and I'll stick with it. Kate?
I'll go. Last week had Leadership Iowa in Cedar Falls. It was more of an IT session. We heard from the mayor in Waterloo, the mayor in Cedar Falls, and the mayor in Cedar Valley. We also heard from the owners of the Lost Island Water Park, and they're actually building a theme park, which was intriguing to hear. Then we did TechWorks campus tours over in Waterloo. And then we had the high-speed internet and technology, which is really interesting. Molly Strauss, the marketing manager, was going through, they're leading in high-tech fiber in Cedar Falls. So it's way neat, interesting presentation that she did. And then we also met with UNI Business Development, Dan Beacon. So it was a great program. This week, I have the newspaper and radio. Tonight I have the Community Foundation Board meeting for West. And then Friday, like Dean said, we have the Emergency Coalition. I will say last week I did talk to Zach probably for 2 hours via phone. And then I did receive some emails and phone calls in regards to the masks and the vaccines, and Dean and I have talked about once about it, and then I will reply to the rest of the emails that I received.
Okay, Clark, do you have anything? Is there any comments from those in attendance or on on social media?
No.
Okay, I see Zach. Do you have anything yet, Zach, or?
No, just listening.
Okay. If
So-
there's not,
So, do we have a conference board meeting on Wednesday?
no. Well, unless she changed it, I don't.
The question was for Tuesday, Dean.
Oh, she wants you to reply by then.
Oh, by noon. Okay, gotcha. Yep. Thank you.
So it's still on,
The 16th.
okay.
All right,
Uh,
gotcha.
Just a reminder, then next week we have, we'll just be governing the budget and doing visiting with the public department heads in regard to the courthouse facilities. And it'd be a good opportunity for us to, Courtney, you can have someone there to update our photo,
Update what?
the photo.
I'm sure one of
Bring
us
your
can take
camera.
a picture, you bet.
Okay.
And I think anybody can do that.
I got you
All
guys.
right.
So just a reminder, we'll meet on the 16th, which is a Tuesday, 9 a.m. at the Conservation Center. We're gonna have both the bison and, I'm not probably gonna pronounce this right, Wapiti room.
It means elk.
The elk room and the bison room. So we'll have plenty of space to spread out and the public is welcome to attend.
Okay.
All right.
All right. If there's nothing else, we're in order for a motion to adjourn.
Motion.
Is there a second? It's been moved and second. Any further discussion? All those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried.